Good. Shit. Very good name. So child is transferring the object. So can you understand? So this is ideally this is a diplegic child, but etiology is hydrocephalus.
Fish. There is a real weakness is there, right?
Shashe Kaushal, Shashe. Right, so you small child, you got toy, right? You cannot break it or then the So yes, it also has been pigmented.
Right. Very good morning, everyone. Right. Good. Great. So, dear students, I'm going to mute you all. Okay. Right. So, guys, I really appreciate if you can switch on your cameras and if you can participate actively. Right. That is very important, and make sure like you have put your correct name in your in your Zoom, right? That is important because only the students are allowed to join, right? Right. Can you please switch on your cameras? Right, Sailor, Andika, can you please switch on your cameras? Okay, right. So here, okay, right. So I think most of y'all are well aware about me. So before I start, I'll give you a small brief introduction about myself. So I am Dr. Ruwanka Livera. Currently, I am attached to Livera Hospital, Colombo, and so I started these classes when I was a pre-intern. Then, like since I had the highest marks ever in history for each and every component, these MCQs, SBAs, the short cases, long cases, everything separately. So from 1996, these documents are there in the SLMC and all the faculties. You can check. And then after that, I started doing these classes. So since I was well aware, I'm well aware about these ERPM and the exams and what is the best. So I started. Then I joined. I got attached to Sigma Institute when I was an RHU. Then I did a lot of postgraduate exams. Again, then after that, then I had gold medals for some postgraduate exams also. But the most important thing is it's not about the qualifications or anything. So it's most important thing is whether you can understand what I'm telling, because so many like professionals are there in this field, but whether you can understand the things clearly and whether I can make a difference, right? So that's the most important thing. So then whether I can make the things very easy, right? So that's why I was able to continue. And since so from the RHO period onwards, from since when I attached to Sigma Institute, most of the other teachers are senior registrars or consultants, and I am still the youngest ERPM teacher. And but I was able to continue since I was able to make the things very easy, super easy, and the pediatric pass rate drastically increased with time, right? So now those days the highest failure rate was there in peds. Now it is the other way around most of the years. So here the thing is, those days I used to teach all the subjects. Now I'm doing, since I have done more postgraduate exams in pediatrics, and since I got attached to Sigma Institute, so then after that I continue only doing pediatrics. So here, I think that's enough. That would be enough about myself. And the thing is, guys, so today we are going to discuss about one of the most important topic. So that is snake bite, snake bite, snake bite. That is extremely important. So why it is so important in your exams? So again, here, this is very important. This lecture, I have mainly targeted for the students who are joining, students who are sitting for the ERPM or final MBBS exams, KDU students, or the ERPM students who are sitting for their final exams. Again, I'm covering all the important facts related to theory exams as well as for the Viva exams, right? So in addition to that, I'm mentioning some practical points also, which are very important during your internship. But I will highlight what are the things which are necessary for your theory exams, and what are things which are necessary for your Viva or the Part C exams, as well as also some points are there which are important in both, right? So I will highlight everything. So then after this lecture, you will have a very clear idea. So right, you will get mastered in snake bites, right? So here, why it is important? The thing is, snake bite is something separate topic, which it comes under poisoning in submodule. But again, one of the important thing is issues like, for example, CNS. So there are so many topics are there where you need to study, right? So but in your exam paper, you are getting maximum of 3 or 2 SBAs, right? And 2 or 3 MCQs out of all these CNS topics, and the respiratory also same. But here the important point is snake bite. Like definitely there will be an 1 or 2 MCQ or SBA, right? So definitely maybe 2 will be there. So definitely you can score, after studying just one topic, you can get complete marks. So the other important point is this topic is common to pediatrics and medicine, both subjects. But here the important thing is the management and everything is same, right? There is no difference except very one point, right? Single point. So everything is same. So if you learn this properly, if you concentrate, and if you learn this, if you study this lecture properly, then definitely you will be able to answer whatever the medicine paper question as well. So again, the other important thing is Part C also for your emergency exam. Again, they are in your emergency Viva, they will definitely ask about, this is a very common topic, favorite topic in both peds as well as in your medicine. So they can ask even in your Viva, in your peds Viva, as well as even the ped component, or even in your medicine component, right? So that's why you need to learn these things, and you should have a very clear, thorough idea about snake bite and the management. So here the important thing is, guys. I hope you all had this PowerPoint presentation. I actually PowerPoint presentation as well as the questions. So I want you to open that. Again, good. Right. So this is about snake bite, and you all can see the screen, right? Right. So Right. So, guys, today I'm going to discuss about about snake bite and management, and I have divided into several subtopics. So, first of all, we will discuss a little bit about the epidemiology, where you don't need to buy hard either for your theory exams or viva, just to have just I'm briefing about the epidemiology, and also you should have an idea regarding venomous snakes. Again, highlight that is really important. So you should have a very clear idea about what are the venomous snakes, right? So definitely they will ask in your theory as well as in your viva. Then what are the common presentation? Again, that is very important, and the identification of the snakes. Right. So again, we will not straight ask in your theory or in your viva straight as a direct question, but of course in your during your internship. So this is very practically this is very important. So you should have some idea about the identification of the snakes. So there are several ways are there, but again, of course, definitely it is important. Definitely it is important in your internship as well as in your both theory and viva, and also the types and effects of the toxins, and finally the management. That is the most important part. So here, right. So guys, so here before we move to the epidemiology, right? So tell me, now there are some familiar faces also there. Now tell me, uh, so you know about snakes. When we talk about snakes and snake bites, so it is in Sri Lankan setup, it is very important. Why? So there is an historical value also there for snakes, right? So most of you all must have heard about these stories, right? So these Mani Akkina Rajuge Katha, right? And these Chulodara Mahodara and these Dutugamunuge love story, right? So you must have heard at least Dutugamunu's one, right? So there is an historical value as well as this is culturally also this is very significant. So because of this cultural effect, sometimes the problem is, guys, so people have used to manipulate our brains also, right? By using snake related stories, right? So the best example is අපිට ඩෝංගාලා විශාල શબ્දයක් ඇහුණා කියලා කිව්වේ, that is one example, right? So then වතුර දෙබෑ කරගෙන කරඬුවක් අරන් ආවා. So right, so that is the best example. So you worship for that, then you voted, and now we are here. So anyway, now the thing is, guys, so since Sri Lanka, right, since there's a lot of cultural and historical values there, so most of Sri Lankans, we used to worship, we have a high regard and dignity for snakes, right? But the thing is, here the important thing is, guys, but unfortunately the WHO has defined these snake bite as the most neglected tropical disease in the world. And unfortunately, the thing is, guys, so out of all the cases among the globe, so the highest number of cases, around 70% of the cases, are seen in South Asian region, that is Bangladesh, India, and Sri Lanka, right? So you will notice the highest number of cases are seen in those countries. And one of the most important things is, guys, unfortunately, most of the years, like a few years back, most of the years, the highest number of deaths were reported in Sri Lanka. Some years it was more than 800 or 900 per year. That is very, very significant. So each year, those days, 800 to 900 patients die following snake bites, right? So that is very significant. So that's why you need to have a very clear idea. So it is very common in Sri Lankan setup, as well as it is the mortality is also very high in Sri Lankan setup. So you should have a very clear idea about snake bites and the management. So here regarding 2019 and 20 data. So these days now the cases the fatality was a little bit less, but overall the incidence was around 80,000, and there are like 40,000 venomous 40,000 hospital admissions are there, because some patients they take native treatments as well, right? And Ayurvedic and native treatments. And also the fatalities 2020 around, it was around 400 to 500, right? So but here one of the important messages, guys, so there is an high rate of snake bite venom is there, and there are around 107 species are there in Sri Lanka, right? So of snakes. And the thing is, guys, one of the important messages, there are only very few venomous snakes are there, right? So there are only 7 venomous snake types are there, and and there are few moderately venomous snakes are there. So that is the most important message. Even there are 107 species are there, majority are non-venomous, right? Most of the snake bites are non-venomous. That is the important message. So you can guarantee marla right? So that is the important message. So here the important thing is, guys, out of these hospital admissions, so the highest incidence we have seen is Halloween hump nose viper. So I will ask a small question. Right, Dilshini, who's hump nose viper? How the hump nose viper again? Just okay if you don't know, right? Yeah, yeah.
Not sure, sir.
Right. Anyone? How the hump nose viper again? And Samahara the Mekali Poidut Nalame, right? But still you all are wearing masks. When you are like in less crowded when you're going to a less crowded area also. So sometimes maybe the problem with your nose. So there is a snake also there, right? So that mask එක දැම්ම නම් හොඳයි නහය පොඩ්ඩක් කවර්. So කවුද? That is what? Puna Katua, right? So Puna Katua. That is the hump nose viper, right? Puna Katua. So I will teach you everything, right? So that is the like in your hospital setup. So most of these admissions are following hump nose viper. But here the important thing is most of the fate mortality is highest. So most of the deaths occurs following Russell's viper bite. Mara Bayanakai, right? Kawat Harime. And most toxic, most toxic snake is cobra. So hump nose viper is Punakatua, Russell's viper is, come on guys, Tipolanga, right? Got it? Okay. Then the cobra is what? Here I have a small question. Okay, right. So Nadira, so tell me, what do you mean by snake? Snake kya nakaude?
Snake, Naya.
So that is one of the common mistake which you count, right? Snake is not Naya, right? Right? Snake is Sarpya. Okay, got it? So Naya is cobra. Got it? So don't right. Make sure you have a very clear idea. So snake is Sarpya, right? The Naya is cobra is Nagya or Naya, right? So the highest toxicity you will notice following cobra bite. Got it? Good. So here, do you want to buy hard this slide? No. Just have a rough idea. That is, it's not necessary to buy hard. Just have a rough idea. But the next slide is important. So you need to know the names, right? Straight. But again, you don't need to know these genetic names because you will not get an OSCE exam, right? ERP students will not get an OSCE exam. So you don't need to know the genetic names, but you need to know the real or Sinhala names also, because like when you're practicing in your hospitals, so patients might tell then you might get confused, right? So you don't need to buy hard these Naja, Bungari, Ceruleus, Bunga, Celonicus, the Roselli, right? So it is carinatum. You don't need to buy hard those things, but you should have an idea what is the Sinhala. You need to know what is the single term as it. So cobra is what? Nagya, right? Nagya. Or the Naya. Okay. Then the common trait, right? Common trait who's common trait? So the common trait is, guys, it's called, the trait is Caravella, right? Trait can Caravella. Common trait tail Caravella. Tail got very oily, right? Tail Caravella like blackish, very oily in nature, right? Allah the lissala yana tail got breeze වගේ. That is තෙල් කරවලා. But sometimes the problem is දැන් ඔයගොල්ලෝ දැකලා ඉතින් දැන් ඔය down south වල ඉන්න අය කියන්නේ දැන් fried rice දැන් කොළඹ ඉන්න අය නම් fried rice කියලා කියනවා. down south වල ඉන්න අය සමහර වෙලාවට කියන උඩ දාන බත් කියලා නේ. So you use various terminologies no, right? Bombay motai වලට සමහර candy පැත්තේ අය කියනවා සීනි පොල් කහුව කියලා එහෙම කියනවානේ. So here the same thing you might see in right, different areas. They use different terms. So some regions they don't use this Caravella term, right? They use this what, the Magamaru, right? So sometimes the patients might say Magamaru. So why they say Magamaru? So most of the time, like this is very dangerous one. So these crates has a lot of neurotoxins, and it is most of the time these bites are very painless, right? So රැට බීලා ඇවිදන් යනවා එකපාර ඩුස් ගාලා වැස්ස දවසක සර්පය හපනවා ගිහිල්ලා දොයිය ගන්නවා උදේ නැගිටිද්දි හෙවන් එකේ or hell එකේ, right? So respiratory paralysis. So මාගඩි කෑවා මැරුණා දන්නෙත් නැහැ. So that's why they have put this maga, right? So it is a very dangerous one. So then the other one important one is Sri Lankan crate. Again, it's not so Sri Lanka. So tell me, so which one is more common in Sri Lankan setup? Sri Lankan crate or common? Lanka වැඩිපුර දකින common crate, the Sri Lankan crate. So Lasit, what do you think?
Sir, common crate.
Very good, common කියලා එකේ. So Sri Lankan කිව්වට Sri Lankan එක Sri Lankan Lanka ඉන්නවා, it's a bit unique, but it's not so common. Common crate is the common one, right? We also call it as Indian crate, right? So here that is the Sinhala term is Mudu Karavela, right? Okay. So then the Russell's viper, you all are well aware, thick polanga. Then saw scale viper, right? So I haven't seen much cases in saw scale viper, but you might see. So right. So most of the time they are stacked in these. You will see those snakes in north and east areas. So you might need to work there, right? So we call it as valley polanga. Valley wala inna hangila valley part. That is saw scale viper, right? So then those are the venomous snakes, most important venomous snakes. Why I have separated those 5 with the last 2? Because the anti venom will be indicated only for these snakes, and it will be effective only for these snakes, right? You can give anti venom only for these 5, right? Keep that in your mind. So for others, even if those are venomous, it is not beneficial. So one of the other important snake is green pit viper. Right? So then this sea snake. So it is there are 13 species out there, but you don't find that much in your hospital setup, right? So sometimes in the coastal regions, maybe 2 to 3 cases over 2 to 3 years, you might notice, but it's not so common in Sri Lankan setup. So but the first 5 are very common, and you should have an idea, very clear idea, and you can save those children, right? And these snakes are highly venomous. So what are the most important venomous snakes? There are 7. So what are those? Again, you need to repeat me. Cobra, common crate, Sri Lankan crate, Russell's viper, and saw scale viper. Those are the most important, and which we can give anti-venom. In addition to that, the green pit viper and the sea snakes, the 13 species, are also venomous snakes, but you can't give anti-venom. Good. So there are some in your day-to-day life, there are so many snakes are there, but I'm not going to tell about everything. So you should have an idea regarding hump nose viper. So hump nose viper is the kuna katua. Why they have put this kuna katua? I kuna katua කියන වචනේ කොයි නහයයි ලොකු දැන් සිංහලෙන් English වලින් නම් they say hump nose viper. That is like සිංහලෙන් they are telling us kuna katua. So guys, because their local reaction is so significant. හට්ටට යනකම් කුණු වෙනවා. ඉදිමිලා necrose වෙලා, right? කුණු වේගෙන හට්ටට යනකම් කුණු වෙනවා. That's why the Sinhala people have put that term, right? So kuna katua, that is very important. So then rat snake, you all are well aware ඔයගලගේ rat පිටු ගාලා සද්ද ඇහෙන්නේ සීලිනේ නේ. So what is that? Garandia, right? Good. Rat snake. You all understand සීලිනේ? Right. Then cat snake. How's the cat snake? ඔයගලගේ සමහර ඇස්සුත් තියෙන්නේ. ඒ වගේ ලොකු ලස්සන පූසෙක් වගේ ඇස් දෙක තියෙනවා. Then so that is Mapila, right? Okay. Right. I think I'm not going to tell about all the snakes. So hope you had a very clear idea. Nasha sent how the Tikirilia kaya kauda. How Tikirilia kaya? Tikirilia kaya Livera ne? So like Kavaragoya Vate Tia Lindaga Tikiri. Neither Livera. So Livera bites again. Yeah, it's not uncommon. So we call it kill them. You don't need to know everything, right? So there are so many snakes are there, but these are the important ones. Good. So guys, so what are the common presentations? So they can present in several ways. So before moving to that, so why now, like you can learn in your medicine as well as in peds, why it is so important to learn in peds? So one of the important thing is, guys, so the pediatric snake bites are quite common. Why it is so, and the mortality or the fatality is very high compared to adults. Why is that? So one reason is, guys, so these kids, they are not well aware about these dangerous habitats. So they put their hands to these caves and they take like a risk habitat. They are not aware. So they take, right. So that's one reason. And sometimes most of these kids, they don't wear slippers. So they run here and there in the garden without wearing slippers. So they are vulnerable to get snake bites. At the same time, guys, the one of the important thing is, so these kids, most of the small kids, they are unable to explain even falling a snake bite. Mother might not know. So till they develop a complication, that is one of the important thing. So that common in so pediatric setup. But tell me, why so it is why the fatality or mortality rate is high? Then lamai naya katti podi kenek na pawne එහෙම කියලා ටිකක් කනවද? නෑ. Right? So the එහෙම කන්නේ නැහැ. But so they will like the toxins or the venom will go into circulation in the same amount for the both kids as well as for the adults. So, but the unfortunately in kids they have a small volume, right? So that's why they are vulnerable to develop more toxic features, right? So that is very dangerous. So that's why the mortality and fatal mortality is very high. So that's why you need to identify early as possible. You need to have a high degree of suspicion and you need to treat early as possible. Good. Now tell me, so what are the common presentations? So they can present in several ways in pediatric setup. So they can present in a known snake bite. So there has been a snake bite and the villagers have come at once and the parents have noticed and they have hit the snake and they have brought the child and the snake both to the hospital. So obviously now you know the snake and you know like exactly whether there's a bite or not. So that is its known snake bite. Now allagatta ඉස්පිරිතාලට ගෙනාවා, right? And that is known snake bite. So then this next one is unknown snake bite. So the unknown snake bite is they might tell මොකෙක් හරි කෑව සර්පෙක් කෑව කාලා ගියා. ඊයා කැලේට රින්ගනේ අම්මා මාව කෑව මේ සර්පේ නායක වගේ කෙනෙක් කෑව දැන් කැලේ අස්සට ගියා. So that is unknown snake bite. So you will not be aware who has bitten. So whether it is venomous or non-venomous, you might not know. So the third one is it's more dangerous. What is it? Unknown bite. අම්මා සතෙක් කෑව කවුද කෑවේ දන්නේ නැහැ. Like මේ ශ්‍රී ලංකාවේ කර හිටියා වත්තේ right මල් පෝච්චි ඇදලා හිටියා සතෙක් කෑව මොකක්ද දන්නේ. mother might say right ඒ හරිය කඩිගුලකුත් තිබ්බා. You will get more confused. Right? So those are very practical issues. Then sometimes guys, so sometimes they can present even just without anything, just with systemic envenoming, right? So because most of the small kids, they are unable to explain or express, so they can present with systemic envenoming feature. I can remember when I was at Kampa, one child came, right? Just mother brought. So child is not opening their eyes. As they are in a has they are right? So then of course there's a mild the doctors have thought like there's a mild periorbital swelling, whether it is congenital nephrotic or something, right? But the reality was it was ptosis. So the whole blood clotting time it was negative, right? It was not prolonged. But I asked to give antivenom and child drastically responded and opened his eyes, right? So otherwise child will die following a respiratory failure, right? So that is following a trade bite, right? So if you are well aware about systemic envenoming features, even if you don't see the snake, you will be able to work out and you will be able to identify the snake, right? So that's why you need to have a very clear idea about systemic envenoming features. So good. So here the important thing is, guys, so now here so identification of the snake. So how are you going to identify the snake? Guys, here the one of the important thing is so you can identify snake in several ways, right? So one important thing is after looking at the snake. So if you notice the characteristic external features, you will be able to identify. Like you can identify. That is the first one. So then the other important thing is sometimes they might not be able to bring the snake. So then, of course, guys, so you can identify, so you can get clues, but it is not so accurate. You can have an idea regarding the bitten site, the time, place, and the geographical area. So you can have an idea what may be the possible bite. So the most important thing is, guys, what so that you can identify after assessing clinical features of the patient, right? So in your exam setup, we want you all to know about what are the clinical features which are unique to each and every snake, right? Good. So if we are mainly questioning about that component. Good. So guys, good. So I will share the screen again. Now, so right, I hope you all can see the screen. Right, right. Hope you all can you all see the screen? Yeah. So if there is any issue, please unmute and let me know. Right. So can you all see the screen? What is this? Yes. So there is an obviously. So this is also identifying the snakes. First of all, so we are going to discuss about how to identify the snakes. So first of all, we are going to discuss about how to identify the snakes according to the external characteristic external features of the snake. Right. So here the first one is, guys, right? So this is about cobra, the Naga. So here the important message is, guys, what? So you will notice a characteristic P-like market. So I am Dakina in almost all the snakes, the cobras, right? All the cobras. So you will notice that is very characteristic. I am that what Nayama Tama. So you will not see any other snakes. So in addition to that, guys, so when the snake cobra get excited, sometimes they might make these folds will get expanded and they might show an hood appearance, right? So again, that is very characteristic in cobras. So the problem is, guys, what is the practical problem? The practical problem එක වෙන්නේ. දැන් hospital එකට එද්දි කොහොමද ගේන්නේ patients ලා? right ගොඩක් වෙලට ගේන්නේ මොකද ඔළුවට ගහලා තමයි ගේන්නේ. So what will happen? So some other column like when I was at Joffrey, it was quite so common. So guarantee kusang, good later, Olugata Gala again. Doctor made iron and anything. No pine Martin Cannon may pine Kuyanari Venomokari Akurata, pain the killer, right? So this is like right. So it's very difficult to identify, right? But that's why you need to have an idea regarding the other features also features as well, but the important message is the characteristic feature is what? So the P and these hood appearance, right? So you will notice in cobra. Unmute and say what is the next one? How the right. So you can see there is an very brownish, these black in color, very oily, crazy appearance is there. And you can see there are pairs, paired white bands, thin white bands on the dorsal surface, and usually their ventral surface is completely uniformly white. So what do you think? Anyone? Can someone unmute and say?
Common trait.
Ah, excellent. Very good. So this is about traits. So this is specifically the common trait. නැත්නම් අපි සිංහලෙන් කියන්නේ මගමාරුව හරි නැත්නම් තෙල් කරවලා කියන්නේ මෙයාට තමයි. Right? So this is oily in nature, and you can see paired of white bands on the dorsal surface and also uniform white color in the belly. That is the characteristic feature. Right? Good. So now you can fill the empty spaces. So this is one. So this is again a little bit, it's almost same. So again, you can see it's very oily in nature, but you don't find very commonly in your these hospital setup. They're like, so here the important thing is again, they are blackish in color and very oily in appearance, but the body surface, these streaks are very thick, right? So and it will extend in both dorsal and the ventral surface. What is this? What is that? Sri Lankan trait or Mundu Karavala is, it's about Mundu Karavala or the Sri Lankan trait. Right, so this is very easy. But what can you see? Of course, guys, when you look at the head, you can see there is an obvious triangular shaped head is there, and you can differentiate from the neck. And obviously you can see there is a V. V is there, and these two lines actually meets at the tip of the snout, right? So again, the thing is, you can see that classically their body is very brownish, and you can see there are three lines of brownish, these dark brownish patches, which have been covered with black demarcations. And also it is in a zigzag nature. So what is this one? Hospital can someone unmute and say? It's easy. Come on, guys, someone, anyone?
Sir Russell's viper.
Excellent. So that is Russell's viper, right? Good, excellent. So this is about vipers, and first one is the Russell. That was the Russell's viper. So so this is one. So here you can see again there is a triangular shaped head is there, and you can differentiate well from the neck, and you can see on the top of the head there is something like a bird's foot. Right? That is very classic. You can highlight bird's foot mark, right? So and also this is, you will notice sandy brownish appearance. Right? So you might notice, so a hissing noise might come. So then you need to think. You might not be able to see because they are like, this is like the reality. They are much more lighter than this. So valuable part of the very like, right? So that's the dangerous part. So the thing is, guys, so what is this one? What do you call this? What is this name?
Saw scale.
Excellent. So this is saw scale viper or the valley polanga, right? So you might see if you work in north and east region, right? Good. So, right. So the next one, guys, again, what is this one? What is this one? What can you see? Can you tell me? What is this thing? If I explain, then you all will be able to tell. Can someone tell what is this name? How do you mean? Come on, guys, anyone?
Hump nose viper.
Excellent. So this is hump nose viper. So you can obviously see. So there is an like now these upturned snout is there. That's called the hump, right? So in addition to that, guys, so you can see there is the snake is like he's keeping his head lift in 45-degree angle. So that is very characteristic, right? So you will notice those features in hump nose viper. So in addition to that, they can have pit between these eyes and the nostrils, right? So that is very characteristic. So this is humped nose viper, and this is very common. You will find there, like brownish, these salmon color bodies there. And because you need to know about this one, because you will find very common in your day-to-day life. So this is about humped nose viper. Good. So here, next one. So here you can see the first one. What is this? Just like the viper, you can see the differentiated. This is a viper. And you can see there are these zigzag, these brownish bodies are there, which has been covered. These brownish patches are there, which has been demarcated with black mark lines, and also they are in the zigzag nature, but the whole body it's greenish in color. So this is also a viper, but this is Palapolanga or the green pit viper. So one of the important thing is, guys, so the first three, it's about Palapolanga. So in your garden, sometimes you might see this fourth one, right? So that is not Palapolanga. So you can see who's that? How the Oglanga Samahalata Gasuda umbrella how the Hari Hemadaki at it's sort of Malpa. What is this? Anyone? Come on. Who a green color. Who's this? Anyone? Any smart person? Come on, guys. So this is very good. What's your name? Can you tell your name? Very good. Excellent. Excellent, right? This is Ahatulla, right? So good. And the thing is, guys, first picture. So Hamadama Ogula Dakina, the Ogulangi get the Hamadami. Who's this snake? So this is Angama Kahapata in Kauda. So this is obviously Garandia or the rat snake. So Kauda may ask the local last and ask the Kapsi and Carter. Right? So that is cat snake or Mapila, right? Got it? Good. So have a rough idea, but I want you all to have an idea regarding the venomous snakes, because during your internship, I want you all to not to miss these important snakes. So then, right. So who's this? Karedang in the You also must have taken photos like this. So this is Python or Timbura, right? So and the last two those are sea snakes, but you don't commonly see in your day-to-day life. Good. Great. So hope you had an idea. Now I hope you are capable of identifying the snakes after looking at the external features. Good. So guys, here again you should have just have a rough idea, because sometimes you can get clues after a bit inside the time, place, and geographical area, and you can guess possible snake bite. So one of the important thing is, right, guys, the cobra. Then Naya Kohumdalama in Badagagina the Dashtakarane. So most of the time you will notice they will bite below the knee, not the ankles, not the toes. So below the knee bites are quite common. So it's between the toes, between ankle and the knee, right? So that is very common in cobra bites. And also most of the time they bite at night near the water areas, right? So that is you will see snakes all over the country. You will be able to find. So here the one of the important thing is patlogan එක තමයි දියබරියා, right? Paturaga in India, right? Make sure you can identify the cobra correctly. Payana and the hood will be there. Classic. So the crate. So here the important thing is, guys, common crates. So here you will find anywhere, right? So and commonly you will notice night rainy season. So September to December. So Vasadasata eli bahinawa godak elita. Very common, right? Parata bahala hana. And sometimes the problem you will see they don't like these cold wet weather. So they come inside the house and they go below these they go under the bed or under the bed. So it is very common. These bites are very common. The children who are sleeping on the floor, right? So I can remember so then after that I asked mother to go and check the under the bed. So they said like I asked so they said like on the floor. So monkey ගිහිලා බුදියන තැන බලන්න. එතකොට මොකද්ද දැක්කේ? ගිහිලා කොට්ටේ උස්සද්දී අම්මයි බබයි දෙන්නම එක කොට්ටේ බුදියන්නේ. කොට්ටයට common trait was there, right? So that is very important. So common trait is you will find anywhere, but it is more common in dry zone. The Sri Lankan trait is something very rare, but again it's more common in wet zones. Okay, right. So I don't want you to by heart this slide, right? So having just rough idea, that would be more than enough. So the Russell's viper, again, just like the cobra, they will bite below the knee, and most of the time dawn and dusk, and when they are walking on the paddy fields. So it is quite more common in dry zones, and it is in the harvest seasons they come out, and it's also an occupational hazard as well. So again, one of the important snake is the hump-nosed viper, hump-nosed viper, hump-nosed viper. Again, why it is so common, and it is commonly placed in these home gardens and the shrub jungles, right? Human living places. So even you posh කියන බොරුවට හරි posh කියන පැතිවල සමහර වෙලාවට you ගොඩක් වෙලට you will find hump-nosed vipers, right? So here commonly they will bite ankles, and they can bite any time, and you will find any area, right? So here the important facts about snakes. So here I want y'all to know about this. So guys, so the cobra, Russells, and the common traits, those are the most important snakes, because which causes the highest mortality and morbidity, and the 95% of the deaths are due to following these three snakes. So the cobra, Russell's viper, and the common traits. So I want y'all to identify, I want y'all to know the correct treatment, and I want y'all to start treatment early as possible after seeing the risk benefit balance. So then the hump-nosed viper is very important. It's quite common, and they will have prominent local effects, right? So, and rarely sometimes they can have renal and hematological effects, but the prominent local effects are there following hump-nosed viper. And also the mortality is very low following hump-nosed. And the saw-scale viper commonly you will notice in northeast region, but the mortality, luckily, the good news is the mortality is less. So the Sri Lankan trait, the green pit viper, and the sea snake viper bites are rare. So most of the time in your questions, we will ask about these common ones. So if you get a question, most of the time it will be about these initial cases, not about the Sri Lankan trait, green pit viper, or sea snake, because you will find rarely. Got it? Good. So, right. So this is the most important thing. So where sometimes, because the most of the small kids, they can present without any evidence of snake or any evidence of bite. They might just present with systemic envenoming features. So that's why you should be able to identify the clinical features. You should be able to identify the snake according to the clinical features of the patient, right? So you should have, before that, you should have an idea regarding the toxins as well as the effect of the snakes. Good. So Nadira, can you unmute and say whether you can see this slide clearly?
So for me, it's a bit blur. Shape it a bit.
Same here, sir.
Blurred.
Yes, sir.
I think you have the soft copy also, right? So you can take your soft copy if you are not so clear, right? You can't see it very clearly, right? So, okay, right? So here the important thing is, students, so there are various types of toxins are there. So following a snake bite, they might release these necrotoxins, or the local, which can cause local tissue damage, right? So sometimes it might contain cardiotoxins, neurotoxins, hemolytic and myolytic toxins, and the coagulation toxins and nephrotoxins. So various types of toxins are there, right? So here the important thing is, so some snakes will have prominent local or necrotic tissue toxins will be there. So which can lead to local swelling, the edema, and the necrosis. So, yeah, so you might see like you might see toxins in almost all the venomous snakes, but there are proportions are there. So classically, you will notice significant amount of local toxins and the effects of that, the local swelling, edema, and the necrosis following what the snakes. So the cobra and nose viper. So I want you all to know, කකුල් දෙක හොඳටම කුණුනොත් කොයි අයගේද වැඩිපුරම දකින්නේ? It can occur even following Russells. But the important thing is classically you will notice in cobra and nose viper. So sometimes you might see there can be cardiotoxins. Those are not so common, but still possible, right? So the thing is, guys, it will be classically noticed in cobra, and they can present with shock, hypertension, and sometimes even following arrhythmias, right? So again, one of the important things is some snakes will have more prominent neurotoxins. So the neurotoxins, again, you guys, one of the important things is the presentation is almost always it's head to toe, and the recovery also will be in vice versa nature. So that's why. So most of these neurotoxin effects, like when they have neurotoxin effects, they will initially present with ptosis and external ophthalmoplegia. That's why it's very important to identify, and like you need to start treatment early as possible. By the next step would be dysphagia, dysarthria, and after that the respiratory muscle paralysis, right? So then once the respiratory muscles get paralysis, they can die. So you need to identify. So it's most of the time it happens in caudal direction. So that's why you need to identify early as possible. They will present with ptosis and external ophthalmoplegia. So what type of snakes will have more neurotoxins? Neurotoxins වැඩිපුර තියෙන මොන්නේ snakes ලද? Guys, keep this in your mind. The classically the crate like neurotoxins crate very significant. In addition to that, the cobra also will have significant neurotoxins. So මොකද වෙන්නේ crate hari cobra කෙනෙක් කෑවොත්? So cobra ගැන කකුල එකපාර ලොකු වෙලා ඉදිමෙනවා, ඊට පස්සේ tosis එනවා, ඊට පස්සේ හුස්ම ගන්න බැරි වෙන්නේ. So then, like with the local effects, you can have some little bit clues. But the crates, of course, these bites are also most of the time painless. So suddenly they can, if you don't identify the ptosis, next step will be the respiratory muscle paralysis, and they can die, right? So that is very important. So sometimes again sea snakes and sometimes even the Russell's viper also you might see, right? Classically, you will notice in crates and cobra. So here the important thing is there are several types of neurotoxins are there. Some neurotoxins, they damage presynaptically or they damage the complete nerves. So the best example is crates. So crate lage මොකක්ද වෙන්නේ presynapse එකේ උඩ කෙලවර damage වෙන්නේ. එතකොට nerve එකට තමයි damage වෙන්නේ. But the cobra, of course, they will bind to these acetylcholine receptors, these toxins. So the postsynaptic effect will diminish. So both will goes into paralysis, the neurological symptoms as well as respiratory paralysis. But the good news is, guys, what the postsynaptic, the cobra, since they have postsynaptic effects, so with the treatment, they will recover soon, right? There were no nerve damage. But the crate's problem in crate bites, the problem is since there is a presynaptic damage is there, so it will damage the nerve and the recovery will take time to recover, and sometimes it can be irreversible as well, right? So that's why sometimes they may require prolonged ventilation following crate bites. So those are some practical issues we find in our day-to-day life. So here the important message is, guys. So then the next one, the hemotoxins, myotoxins, and coagulation toxins, and sometimes nephrotoxins. So those toxins, most of the time, you will classically notice in viper bites, right? කොළඟෙක් ගහපුවාම තමයි ගොඩක් වෙලට blood වලට damage වෙන්නේ, muscles break down වෙන්නේ, red blood cells destroy වෙනවා, coagulation studies alter වෙනවා, right? Muscles damage වෙනවා, ඒ වගේම kidneys අවුල් යනවා. So they might present with, they can have pale, myalgia and acute kidney disease, and sometimes they can have the oozing, bleeding, right? Bleeding manifestations, and also acute kidney disease followed by chronic kidney disease they can present, right? So here the important thing is sometimes the important thing is even these hemotoxins and the coagulation toxins are quite common. They might not present with clinical evidence of bleeding. Hospital එකට එද්දි ලේ ගලන්නේ නැහැ මොකද? Right? So the less than 5% will present as obvious macroscopic or microscopic bleeding. But the thing is here, the important thing is in majority, the whole blood clot in bites, the most of these patients will have prolonged whole blood clotting time and altered PTINR. Right? So that is the important message. Good. Right. So here, now the thing is, I want you all to go through the previous slide, and I want you all to fill this graph. Right? We'll see whether you can fill this graph correctly. Right, I want you all to go through that slide because it is very important, right? Extremely important. So previous one, and I want you to study. I want you to try hard. So again, you can see snake, local manifestations, cardiac manifestations, neurological manifestations, then the hematological as well as acute renal failure. Now tell me, as a first one we will talk about cobra, right? So here the important thing is cobra, Russell viper, like most of these snakes can cause anything, right? ඕන එකක් වෙන්න පුළුවන් hospital එකේ ඕන දෙයක් වෙන්න පුළුවන්. But there are common things and less common ones are Livera, log වෙලා ඉන්නේ. මගේ වීඩියෝ එකේ ප්‍රොබ්ලම් එකක් තියෙනවා. දැන් හරියද බලන්න? හරි. Right, guys, can you all hear me? Can you all see me? Sorry, there's a connection error. I hope you all can see me and I hope you all can hear me, right? So if there's any issue, please let me know, right? Good, great. So here the important message is, guys, so the cobra bites, so they can have, right? So here the important thing is they can have significant local effects. Right? So that is very important. At the same time, guys, the cardiac effects are also possible. But it is not so common, but yes, it is yes. Because you will not find that those cardiac effects in other snake bites, but yes, cobra, yes, you can see. The next important thing is they will have significant neurological effects. So they can have ptosis and the respiratory paralysis commonly. So if you notice the local effects and the neurological effects, that is what? Following cobra bite. Easy. Got it? Good. So next one. So the crate. So you might write crate. So in Sri Lanka setup, you will commonly notice common crate. So what are the classic features? So here the thing is Magamarua. It's a painless bite. So will you notice local effects? No. Will you notice the cardiac manifestations? Usually not. The hematological and acute renal failure, extremely rare. So classically, you will notice the neurological. So suddenly they goes into, so they will develop ptosis and they will have respiratory habits. Got it? Easy? Yeah. Respiratory paralysis. Yes. Then the third one. So the third one is, guys, what the Russell's. The Russell's viper. Of the vipers, Russell's are saw scale viper, right? So it is possible. So both are vipers, right? So these Russell's viper is bit more toxic. So here the important message is, guys, what? So they can have, of course, they can have local effects, the cardiac effects, or the neurological effects, but they will classically have what? One of the classically in it. So the hemotoxins, will have hemotoxins and the nephrotoxins and the myotoxins. So they will have hemolysis, right? Hemoglobinuria, myoglobinuria, and they can have coagulopathy and the easy acute renal failure. So they can have hematological manifestations and the renal failure. Kawhari can bleed දෙනවා, මුත්‍රා එක ලේ යනවා, මුත්‍රා තද පාටට යනවා, මුත්‍රා යනක shutdown වෙනවා. That is what? That is about Russell's Russell. But here the important thing is Russell is a very dangerous disease. It can have, right? Whatever the thing, neurological anything, but classically you will notice these hemotoxins and the nephrotoxin effect. Got it? So is it easy? Yeah, it's extremely easy. So if you know those things, then so finally these last important one that is not so that we don't categorize on the venomous snakes. So here the important one is how bite. But the near future these guidelines might change regarding hump nose viper, right? Keep that in your mind. Because there are 4 species are there. Hump nose viper. සමහර අයට වෙනම් දෙන එක ඉෆෙක්ටිව්ද නැද්ද දැන් කතාව යනවා. Right? ඔක ඉස්සරහට තව ටික දවසකින් වෙනස් වෙන්න පුළුවන්. So here they regard these things regarding hump nose viper, they will have classically the local. කට්ටට යනකම් කුණු වෙනවා. But usually you will not hardly find this cardiac or neurological කලාතුරකින් hematological and nephrotoxin තියෙන්න පුළුවන්. In some species. So they will have isolated local manifestations commonly. Right? Got it? Easy. Good. Easy there? Easy. Right? දැන් ආයෙ වර්ධිනවද? නැහැ. ආයෙ නායක අඳුර ගන්න අමාරුයිද? නැහැ. Right? exam එකේ වර්ධියට මාක් කරන්න පුළුවන්ද? බෑ. fail වෙන්න පුළුවන්ද? හරිම අමාරුයි. බෑ. Right? හරිද? fail වෙනවා නම් ඒ ළමයට tag එකක් දෙන්න ඕනේ. Okay? So there can be two reasons. One thing is the main reason is most of students get failed because they don't get a proper guidance. So if you don't get a proper guidance, then you can get failed. Some very rarely some students are there, they don't have trust. So guidance එක තියෙනවා ඒ වුණාට පඬිතුකමට මම තමයි දන්නේ කියලා හිතාගෙන ඉන්නවනේ, again impossible. Then of course there is no way. If you get the proper guidance and if you have the faith and if you are following our instructions, then there is no way to get failed. මගේ theory ළමයින්ගෙන් කී දෙනෙක් fail වෙනවද? theory course එකට join වෙච්ච මෙච්චර අවුරුදු ගානටම theory course එකට join වෙච්ච ළමයි pass failure rate 0. theory course එක cover කරපු ළමයි කවුරුත් fail වෙලා නැහැ. ගිය පාර pass rate 100%. Last time, the previous time, yes. Every day it was like that. But the important thing is there are some students are unfortunately they were not aware at the beginning. They have got to know me like after some time, and the thing is they have paid some other teachers, and they were not aware. So they finally most of the students at least they joined some courses like MCQ based topic price revision, and definitely majority joined for this SPH course. So it failed and they failed in. Last time only 2 students. The previous time, right, again same. ඊට කලින් පාර there is a huge batch. 237 students are there. එතනින් 4 දෙනායි fail හිටියේ. ඒගොල්ලෝ they have covered only 4 out of 10 lectures. Less than 4 out of 10 lectures. So not possible to get failed, right? So but if you like if you don't get the proper guidance, and then yes, it's difficult, right? So make sure like whether you select the correct teacher, right? එක එක අයට හැමෝටම අල්ලන්න එකම එක්කෙනා නෙමෙයි, එක එක අයට අල්ලන අය ඉන්නවා. තමුන්ට ගැලපෙන එක්කෙනා යනවාද කියලා අපි levels වලට එක එක අයවනේ අල්ලන්නේ. First then make sure like you follow those instructions properly. It's very hard to get ERP මේ කාලේ මම දන්නේ fail වෙනවා කියන පුදුම විදිහේ නේද, like a few years back, right? Like 10 years back it was horrible. මට ඒ කාලේ මම when I was a pre-intern, I used to work in a private hospital. Foreign graduates la ගාලා හිටියා. Foreign graduates la ඔක්කොමලා 40 පෑන්නයි uncle auntie ලා. Right? මේ ඊට පස්සේ මම කරේ මම ඒ කාලේ ටීචර් මම කිව්වා හරි මගේ මේකට එන්නේ then ඒ කාලේ ඔක්කොම subjects උගන්වන්නේ ඒ කාලේ right ඔක්කොමලා එක short එකකින් කොට දාලා දුන්නා. Right, it was like that. It was දැන් උනත් සමහර අය කතා කරන්නේ දැන් මම හිරියාර කරනවා boy girlfriend දාලා ගියා, right? That will happen, right? So that will not happen if you follow the instructions, if you follow the things properly, and if you follow the instructions, right? Good. So here, hope you had a very clear idea. So we are going to start the next most important part. Before that, I want you to know whether you understood everything very clearly. So we discussed a little bit about epidemiology, which I don't want you all to study or by heart. Then we discussed about the types of venomous snakes, where you need to know the Sinhala names in your day-to-day practice. Right? Take a Sinhala name, not the scientific name. Then just have an idea about the common presentation and the identification of snakes according to the external characteristic features, because the external features are important in your day-to-day life, not in your MCQs, right? Again, try to identify the snake according to the bitten site and the time and the place and the geographical area. Again, we will not frequently assess in your theory exams or even in your parts. But definitely we will assess your knowledge regarding the clinical features of the patients, right? So identification of the snakes according to the clinical features. That is very important, right? In your exam paper, right? Exam point of view. So here the important thing is these cobras, they will have classically the local effects and the neurological effects and plus or minus cardiac effects. Then these crates, they will have isolated neurological effects. And the Russells, these vipers, classically they will have hematological effects as well as nephrological effects. And the other important thing is these hump nose viper. Again, they can have isolated local effects, right? So if you have a very clear idea, then you will be able to answer most of these questions, right? So you should have a generalized idea. At the same time, you need to know what is more important and what you need to focus to score more marks in your exams, right? So hope you had a very clear idea. So exam මතක තියාගන්න ළමයි ඔළුවේ ඔයගලන්ගේ capacity එකක් තියෙනවා. You have 7 subjects to study, right? This is not a bio exam. This is not a scholarship exam, right? ඔහේ ඔක්කොම පාඩම් කරන එකවත් ඔක්කොම පොත් ටික පාඩම් කරන එකවත් හොගාල question කරන එකෙන්වත් මොකොත් වෙනසක් වෙන්නේ නැහැ. That will cause more harm than the good. So just you need, that's why we are guiding you. Know what do you need to know as a basic, and what do you need to buy hard, and what is more important, and how the question comes. So then you will be able to answer whatever the question. You will be able to perform well in your viva as well, right? So hope you had a very clear idea. Good. Right. So we'll move to the next. So I want you all to concentrate, and I want you all to, right, listen carefully. So if you are tired, I want you all to drink some water and stand and sit, right? Stand up and sit. How did it? You're fresh. Hope you all are very fresh. Right. Good. Guys, so we are moving to next most important part, that is the management of snake bite. So I have divided into 5 areas. So where that is 5 areas. So here, so you can have a 5-step approach. Main step then the people who are doing viva, right? So make sure like most of the students have finished their vivas only, except one station, right? So the people who are doing viva, make sure like you go according to this 5-step approach, right? Steps පහක් තියෙනවා. මේ steps පහ ඇතුළේ කතා කරනවා කියලා. So the first important thing is, guys, one, so the stabilization, or the ABC management, right? So that should be there. Then the next one is the first aid treatment, right? So you can ගෙදර ඉන්න patient ගෙදර ඉන්න එක්කෙනා නෑ මුලදී මේක කරන්න ඕනේ. lay person කෙනෙක් hospital එකට ආපුවම සමහර වෙලාවට ඒ දේවල් කරන්න වෙනවා. So then you need to do relevant investigations and deciding, or the decision of giving antivenom. So you need to decide whether you are going to give antivenom or not, because giving antivenom is it's a very serious thing, because they can have a lot of reactions. So one of the important messages is, guys, following snake bite, children can die. A lot of children can die. They can die due to the snake bite or the effect of the toxins itself, or maybe due to the treatment itself, right? So they can die following treatment. So that's why you need to always consider risk-benefit balance. It's a huge decision. So you need to decide whether you are going to give antivenom or not, right? So then the supportive care and the management of the complications. So those are the main 5 components. And finally, you can discuss a little bit about prevention of further attacks. Good. So first of all, we'll talk about stabilization of airway breathing circulation. So the ABC management is very important. So the most of the children, they present they are stable at the presentation, but there are some cases are there. So if they don't come quickly, they can present with unstable airway breathing circulation. So because sometimes like the children are unaware about snake bite, and they are unable to explain, and some patients, they go for these native and the Ayurvedic treatments. Again, I'm not telling those are bad, but we are not aware. But right? Okay. So that's I think it might not work. So they can come late to the hospital. So they can come with unstable airway breathing circulation. So make sure when the child comes to the hospital, you check the airway breathing circulation, you attach a pulse oximeter, assess the airway, assess the breathing, and assess the circulation. So if there's any compromise, you need to attend to those things early as possible. So most of what's the problem? So for instance, these snake bites, especially for neurotoxins, they can have respiratory paralysis, they can have poor cough drive, so they can have loss of consciousness, they can have aspirations, they can have these bulbar palsies and the respiratory failure, and the patients might require NG tube, maybe bag and mask ventilation, and as well as sometimes intubation and the ventilation. And also here the important thing is some patients, they can have significant leaking and maybe oozing, leaking, bleeding, right? And also sometimes they can present with shock, and maybe they can present with the bleeding, significant bleeding, and maybe with arrhythmia. So make sure you stabilize the circulation as well, assist the circulation properly, and maybe if necessary attach to a cardiac monitor, insert and wide bore cannulas, and insert and urine catheter if necessary, and if really necessary, insert and CVP line as well to monitor the patient closely, right? So it always depends. It's a clinical judgment. Hamma patient you assess clinically and you do relevant necessary interventions. So after stabilizing those patients, so you need to manage the airway breathing circulation. They might require fluid bolus, they might require the ventilatory support. So after stabilizing the airway breathing circulation, make sure the next important thing is not the stabilization, that is, but these first aid management or the first aid treatment, right? So what are the first aid treatment or the management? What are the first aid විදියට මේවා කරන්නේ? So here ගෙදර ඉන්නවා නම් ගෙදර දේ දැන් හිතන්න ඉන්නවා practical setup. ගෙදර ඉන්න කවුරු හරි නායක කෑවොත් ඔයා ගේන විදිය ඕකේ ඔක තමයි mainly. හැබැයි hospital එකට ආපුවම make sure you practice those things. So one of the important thing is you calm the child, right? දැන් මොකද වෙන්නේ? අම්මා නටනවා. මිසි නටනවා. ඕගොල්ලෝ වැඩේ දන්නේ නැත්තම් ඕගොල්ලොත් නටනවා. What will happen? කොල්ල බලන් ඉන්නවා, කොල්ල panic වෙනවා. What will happen? These child will secrete more and more catecholamines, and the more and more toxins will absorb from the local site. So මොකද වෙන්නේ? ළමයා ඉක්මනටම මැරෙනවා. Right? So make sure you calm the child and try to reassure, right? බයෙන් එපා. අපි මේ ස්නායු කාලේ නමුත් අපි ඔයා කලබල නොවී ඉන්න. අපි කරන්න පුළුවන් දේවල් ඔක්කොම කරනවා. එතකොට බබා ඉක්මනට සනීප වෙයි, right? කියලා කියන්නේ. right? පුළුවන් දේවල් සියල්ල කරනවා. ඉක්මනට බොහෝ වෙලාවට මේකට බබා ඉක්මනට අපි ප්‍රතිකාර කරොත් ඉක්මනට ආන්සර් කරනවා. බබා ඉක්මනට සනීප වෙයි. හරියට ප්‍රතිකාර වැටුණා. right? So you calm the child. Right? Because these catecholamines can increase the absorption. So here one of the important thing is like make sure like you try to minimize the absorption, right? So that's why you need to calm the child. So one of the important thing is at the same time wash the bitten area with soap and water. And also try to immobilize the limb with a splint. පල්ලෙහාට කරලා තියන්න ඕනේ. So try to keep it below the heart level. කකුල උස්සලා තියනවා මේවා. So it can go right heart එකට යන්න පුළුවන්. Okay? So ඔයා තව මේවා කරන කකුල මසාජ් කරනවා, තව මේවා කරනවා, right? That will worsen the condition. Okay? So then of course guys, what one of the important thing is you remove the accessories. දැන් ඇඟිල්ල කාලා එනවා. wife කියලා තියෙනවා කිසිම හේතුවකින්ද මුද්ද ගලවන්න තහනම්. එහෙම වැහැලවයි, right? දැන් ඕක ඇඟිල්ල අතේ ඇඟිල්ල කාලා ඕක ඉදිමුණොත් මොකද වෙන්නේ? ඊට පස්සේ අර වැල්ඩින් කාර්යය වගේ ඉන්න වෙනවා ඉස්පිරිතාලට මුද්ද කපන්න. right? So they will the finger can get completely necrosed. Blood supply cut off වෙලා, right? So that's why if there's any accessories you need to remove, right? So they can have swelling, right? Localized swelling is quite common. Even they can have systemic swellings as well. So here the one of the important thing is guys, do not, make sure you do not panic. Do not suck. Right? Okay, right? So here then the thing is guys, do not cut. Right? It might worsen the condition. So do not keep ice packs. So sometimes it might absorb more, and do not put any tourniquets, right? Good. So those are very important. So you don't practice those things. So then after doing this state management, so immediately like you need to insert and like as soon as you insert an IV cannula, try to draw the blood for the investigations and make sure you take the blood for the relevant investigations. So as house officers, What is the most important bedside investigation you are going to arrange as house officers? Following a snake bite, guys, the 20 minutes whole blood clotting time. So that is the most important investigations, because like you can have a lot of idea, because when you send the investigations to the lab, it takes so many hours. Then we night කාලෙන්නේ මහ රෑ lab එකේ මිනිස්සයා ඇරන් ඉන්න, මොකද රෑට night lab දාපුවම එයාට අර investigate කරන්න ගානක් හම්බ වෙනවා. එහෙම එකක් තියෙනවා, but they හැබැයි ඉක්මනට report එක එරුවා කියලා ගාන වැඩි වෙන්නේ නැහැ. දැන් පාන්දර 5ට විතර තමයි ඔක්කොම එවන්නේ. Right, so I think they will investigate, but they won't be like, they will not send those things very immediately. So it might take a few hours. So the whole blood clot time, clotting, 20 minutes whole blood clotting time will give a lot of clues. So whether there is an hemotoxins are there, and sometimes right, so it will get prolonged mainly following hemotoxins, right? Good, coagular toxins and hemotoxins. So that is there. But one of the important messages, then ඔයගොල්ලෝ intern කරද්දි සමහර වෙලාවට මෙහෙම whole blood clotting time. එහෙම නැහැ. Right? So keep that in your mind. It is not 100% accurate, and it's less sensitive and specific. So sometimes the important thing is you might miss 1/5 of these cases which requires antivenom, right? So that is possible. ඒකත් ඔළුවේ තියාගන්න ඕන. Whole blood clotting time එක normal වුණා කියන එකෙම කිසි දෙයක් හැම වෙලේම මේ අවුලක් නැහැ වෙන්නේ නැහැ. And the other important thing is, guys, but sometimes most of you all are practicing in a wrong way. So again, like you might think a child has been bitten by a venomous snake, right? So you need to know how to do the whole blood clotting time, arrange the whole blood clotting time in a correct way, because you are not sending that blood sample to the lab. You are doing then and there over the bedside. What එකේ ඔයා තමයි කරන්නේ, right? ජීවිතේ ඔයාගේ අතේ, right? Right? So that's why we are very particular about these pediatric emergencies, right? ළමෙක් මැරෙන්න දෙන්න බෑ. Medical wards, මැරෙන්න දෙන්න බෑ ethically. But what practically happens is like ඔයගොල්ලන්ගේ seniors ලගේ නම් they will tell මොනවද internship එකේ වැඩිම ඉගෙන ගත්ත medical ward එකේ death certificate ලියන්න. Right? ඒකනේ හැදීමේ මෙයාත් උදේ පාන්දර මැරෙනවා. මෙයාත් මේ ආච්චිත් මැරලා. මේ සීයා හොඳට උදේ හිටියනේ. Right? Right? So but pediatrics, it's not like that, right? You will not find right death commonly, and just in case if it happened, marunan, and it will be a huge trouble, right? Right? Okay, so make sure, that's why we are very particular about those things. Okay, good. And it is fair to expect high standard in part C emergency exams, right? Level okay, good. So here the thing is, guys, you need to do the 20 minutes whole blood clotting time. So that is important as a head show, very important. At the same time, keep this in your mind, but the most accurate one, so you can have a very clear idea, you can quantify. The PTI-NR-APTT is the most important investigation, and the investigation of choice if the facilities are available to take urgent report. Report එක ටක් ගාලා ගන්න පුළුවන් නම් මෙයා. So but the most of the centers, they will not be able to give a urgent report. ටක් ගාලා report එක දෙන්න බෑ. So only very few teaching hospitals will be able to give the urgent report. Then if the facilities are available, yes. Right? So and also there is in some centers they are using a strip test, but again it is very inaccurate following a snake bite, right? Good. So here the thing is, guys, once you insert that, they have an idea about those two most important investigations. At the same time, you may need to take blood for the investigation. So of course, you need to take a full blood for the full blood count and blood picture. You can have an idea regarding hemolysis, right? Hemolysis, and also the renal function test and the electrolytes. So why the electrolyte levels are why important? So tell me, Iqbal, can you guess? It's okay, just tell. It's okay, you can make any mistakes. So why do you think these electrolytes are important? So you don't make mistakes. Any idea? But we will ask from students who are doing Viva. Nadi, so tell.
So, just in case there's renal failure, there could be hyperkalemia,
Excellent.
and
So,
that could lead to arrhythmia. So that's mostly.
So renal failure is quite common, and they can have hyperkalemia, and of course they can have go into renal failure. So what are the ways of getting hyperkalemia? Following a snake bite. One thing is, as you mentioned, renal failure. Any other way? Adi? Since you are a right smart student, I asked that, but again, it's okay.
I'm
So,
not sure, sir.
not sure. So the one of the important thing is, guys, as I mentioned previously, so some toxins can cause breakdown of the muscles, breakdown of the red cells. So these cells will release more and more potassium, right? So hyperkalemia is very dangerous. They can have arrhythmias, right? Good. So in addition to that, you can do UFR to take evidence of hematuria, as well as VBG is important. Why the VBG is important? Guys, it's not only about assessing the acidosis and the alkalosis. So when you send the samples to these lab, so I told you all that it will take hours to get the report. But the VBG we are sending to the ICU or somewhere the VBG machine is available. So most of the time in the ICU. So you can get the report within few minutes, within 5 minutes. So the VBG reports will mention about all the information related to acidosis and alkalosis. Not only that, it will give a rough guidance about the electrolyte levels. It has mentioned the sodium levels, the potassium, the calcium, the hemoglobin, the hematocrit, everything. So you will have a very good idea regarding what is happening, and you can get a very good, very early report, right? So that is the importance of doing a VBG. And also you need to send for the blood grouping and DET, and maybe you may need to attach a cardiac monitor or ECG. So the children who are heading into a respiratory paralysis, you may need to monitor its spirometry, right? Because peak expiratory flow meter is not useful. It is useful for obstructive airway lesions, but the most of these conditions will lead to restrictive lung disease or the respiratory muscle paralysis. You need to monitor with spirometry. And if they have evidence of focal neurological signs, or if you're suspecting intracranial hemorrhage, may require CT brain as well. Good. So thing is, guys, so how are you going to arrange a 20 minutes whole blood clotting time? So guys, you need to know, because in your viva also this definitely they will ask, how are you going to do it? Because you are the person who needs to do in your ward setup, right? So good. So here thing is, guys, you need to take 5 ml of fresh venous sample. ඔය වචන highlight කරන 5 ml fresh. පැත්තක තියලා තිබිලා කොයි හරි මිස් කෙනෙක් blood එකක් syringe එකට අරන් ගත්ත එකක් අරගෙන දාන්න බෑ. It should be fresh sample. So you put into a new කලින් පාවිච්චි කරලා හොදලා detergent දාලා අනම්මනම් තිබ්බේව බෑ. New plain dry glass vessel or the test tube. අලුත් test tube එකක් ගන්න ඕනේ. And leave it for 20 minutes undisturbed in room temperature. Room temperature is disturbed නොකර තියන්න ඕනේ. දැන් මොකද කරන්නේ? ගොඩක් අය what we have practically seen. මිනිත්තු 10ක් බල ඉන්නවා තියලා. මිනිත්තු 5ේදී හොලවල බලනවා. තාම ක්ලොක් වෙලා නැහැ. මිනිත්තු 10ේදී හොලවල බලනවා. ක්ලොක් වෙලා නැහැ. මිනිත්තු 20ේදී හොලවල බලනවා. ක්ලොක් වෙලා නැහැ. ක්ලොක් වෙලා නැහැ කියලා හිතනවා. No, it's wrong. You need to keep it for 20 minutes undisturbed, right? At the same time, guys, one of the important thing is here the whole blood clotting time. Practical what we have seen is antivenom they know it's very expensive and it causes a lot of reactions. Most of the people used to say, oh, clot pelanet. The practical issue is they are taking the blood and keeping on the top of the table, and the ceiling fan is just on top of that. The hulang gaheno make helleno. I think clot in. So make sure you keep it somewhere, right? Large or undisturbed, right? So that is very important. So after 20 minutes, you can interpret, right? So you need to look at the tip of the blood vessel, right? Tip of the vessel or the tip of these, right? Or the test tube, and check whether the blood is still liquid, right? Unclotted, right? And if not, so you need to consider it as venom-induced coagulopathy is there. Got it? පැහැදිලිද? මිනිත්තු 20කින් හරවද්දි කෙලවර ටික හරි හැලෙනවා නම් ලූස් වෙලා නම් Good. Are you clear? Right. So easy? Yeah, it's easy. Right. So guys, now the next important thing is decision of giving antivenom or not. So that is a big decision, right? Because the child can, if you delay the treatment, again child can die. Again, if you start sometimes with your treatment, again child can die. ඔයා knowledge වැදගත් දේ මොකද්ද? ළමයා මැරෙන්න පුළුවන් කොයි හරි විදිහකට. knowledge එක හරියට නැතුව වැඩේ කරොත් මොකද වෙන්නේ? උසාවි ගිහිල්ලා කුඩුවේ යන්න පුළුවන්. අනෙක් පැත්තේ අපායට යන්නත් පුළුවන්. It is possible. So here the thing is, guys, you need to think about risk benefit balance, and if it is really indicated, you need to give it early as possible. So the thing is, guys, so here the important message is it's antivenom is life-saving, and it will immediately neutralize the toxins. Toxins neutralize. So that is the good part. But the other hand, the other important thing is the problem is, guys, but you can't reverse the effect which has been already had. Picture damage reverse karanna bad. So what will happen? So if you delay the treatment, so they will develop more and more complications. So if it is really indicated, you need to start the treatment early as possible, but you don't give unnecessarily as well, right? So that's why if it is indicated, you need to start early as possible and give early as possible, right? So what are the problems of giving antivenom? One thing is it's very expensive. Now the 1 vial is more, it will cost around more than 1 lakh. And the other important thing is, guys, so the treatment itself can cause these antivenom can cause a lot of reactions. They can cause these anaphylaxis reactions. So it's very common. So 85% of these children will develop anaphylaxis following antivenom treatment. 10 දෙනෙක් ගත්තොත් 8කට 9කටම anaphylaxis එනවා මේක ගහපුවම. So common, right? And the other important thing is not only the anaphylaxis, sometimes they can develop other reactions as well. They might develop, like after some time, they can develop very high grade fever following pyogenic reactions. And after several weeks, they might develop some fever, rash, lymphadenitis, arthralgia. So we call it a serum sickness. Again, late reactions also, it's quite common. So that's why it's caused a lot of problems. So you give it only if it is indicated, but if it is indicated, you need to give it early as possible. So you always need to consider about risk-benefit balance, and you need to give it. Got it? So you should have a very clear idea. So what is it? So the indication for giving antivenom, right? That is very important. So one of the important thing is, guys, so the first one is, guys, witness of obvious venomous snake with initial non-specific sign. So why I have mentioned witness of obvious venomous snake? What is the reason? Then what is the practical problem? Then බලද්දි මොකද ඌ අහිංසකෙක් නෑ ඌ කාලත් නෑ ඌ දන්නෙත් නෑ කතන්දර ඌ පැත්තකට හිටලා ඉන්නවා මොකද නයි ඔක්කොමලා එක ඒ සර්පියෝ එක ගුහාවල් උඹවල් පහස්තින් තැන්වල තමයි කැරකැරක ඉන්නේ කැලේවල might bring in some other snake, right? That is one problem. So make sure there is an obvious witness. The other important thing is, guys, like even then හිතන නයා කෑවා දැන් මෙහෙම එකක් හිතන්න. I will ask this. Dilshini, can you give me the answer? There's an obvious Russell's white bite. Just after that, they were able to catch the snake, and they brought to the hospital, and they confirmed that he's a Russell's white. Then kava sata sure anna lamyawa kala in. Do you need to give antivenom? No. Lasita. So Lasita, can you tell me?
First of all, I will check if there is any systemic envenomation. Then after I will decide.
Okay. Then this is the important message, guys. Then Hitanda Lasita. Do you have a girlfriend? No. Sure, maybe.
No, sir. Yeah.
Okay, right. Then Hitanda, is she here? No.
No.
Okay, good. So here, then the girlfriend ඔයාව එකපාර ඔයාව ඉන්නවා ඔයාව හැපුවා. අර හැපුවා. This is related. I'm teaching related to snake bites, not related to rabies or something. Now tell me, they හැපුවොත් what are the possibilities? What are the possibilities? Girlfriend හැපුවොත් මොකක්ද possibilities? She has converted into a Dracula කියලා හිතන්නේ නේද? Right. මොකක්ද? What are the possibilities? Yes.
I will get
Dracula වෙන්න පුළුවන්. Yeah, that is yes.
I will get a wound and I will get.
No. I'm asking what are the possibilities? ඇයි හැපුවේ? I have Dracula වුණත් ඔයාට affair එක continue කරන්න පුළුවන්ද? Dracula කෙනෙක් වෙලා හැපලා නැහැ. ආතරින්ද වෙනවා. We are very holy, no? So bad. Okay. What are the other possibilities? Probably holy. Huh? Yes. Then what are the other ones? ඔයා ගිහිලා ගෑන් ළමෙක් දිහා බලන් හිටියා. කෙලින් කියන්නේ නැහැ. තරහ ගියා. තරහ පිට කරන්න කොහමද? අන්න හපලා. දරුණු හැපිල්ලක්. හපලා that is it possible? Yes, තරහට හපන එක. So again, is it problematic or not? දැන් හිතනවා ඇත්තටම ගෑන් ළමයි බැලුවේ නැහැ. එයාට සැකයක් තිබ්බා. එහෙම කරලා හැපුවා. හැබැයි තරහට හපන. Is it problematic? Yes. It's problematic. අනිත් possibility එක මොකද්ද? What is the other possibility? ඈ? එයා ආදරේට හපන්නත් පුළුවන්. නේද? කතා ආදරේ පෙන්නන විදියක්. එයාට ආදරේට හපන්නත් පුළුවන්. දැන් ඔයා ආදරේට හැපුවොත් අතාරිනවද? නෑ. Same here. Right? Naya ආදරේට හැපුවොත් අවුල්ද? නෑ. So guys, here the important message is, guys, right? So I share, I don't know whether you saw, I shared a small video in this these WhatsApp status, right? So there is another හාමුදුරු කෙනෙක් මෙහෙම හපා ගන්නවා. දැන් ඒකේ හොඳටම තුවාලෙත් පේනවා. මේවත් පේනවා. දැන් ඇන්ටි වෙනම් දෙන්න ඕනේද? නෑ. ඒක අවුල්ද? නෑ. ඒකත් හරියට ආදරේට ආදරේ හෝ හපුක එක වැඩක් නෑ. පුස් හැපිල්ලක්. So පුස් හැපිල්ලට අපි මොකද්ද කියන්නේ ළමයි? So we call it as dry bite. So if there is a dry bite, you don't need to worry, right? දැන් ඔක මැජික් වගේ Facebook එහෙමද? ඉතින් යනවනේ හොව ගාලා මේ පැත්තේ ඉඳලා දකුණේ ඉඳලාම යනවා අනුරාධපුරේට බෙහෙත් කරගන්න. ඇත්තට සර්පයා කෑවොත් ඉතින් අනුරාධපුරේට යද්දි මැරිලා. Sometimes if it is dry bite, so that will not happen. So what is dry bite? So Lasita, any idea about dry bite? No. හිතන්න for example. Right, දැන් හිතන්න for a girl. Then girl කෙනෙක්, she is a virgin. And the parents have done all these scans prior to the marriage and everything. And the anatomy and everything was normal. Right? Then she was in the fertile period. And she has slept with a man. Right? Anatomy එකත් හොඳයි. Fertile period එකෙත් ඉන්නේ. ඔන්න දැන් පිරිමි කෙනෙක් එක්කත් බුදිය ගත්තා. But didn't get pregnant. So what are the possibilities? This Lasita, any idea? Samat, any idea? You can help. What are the possibilities? Not knowledge. And the ළමයි කම්බෙන්නේ නැති වෙන්න හේතු ගෑනු කෙනා completely normal.
Maybe the male is subfertile or infertile.
Very good. So one thing is, yeah, male is subfertile. So the subfertility can be due to so many things. මොනවාද වෙන්න පුළුවන්? Like they are not, male is not producing adequate amount of sperm. So the sperm එකක් හරි මොකක් කරන sperm හරියට මේ වෙන්නේ නැත්නම් yes. මාර්ගේ block එකක් තියෙන්න පුළුවන්. He is not, you know. Then the other possibility is what? Maybe YSI, impotence and everything is there. Oh, what are the other possibilities? So must have ejaculated previously. Or must have slept with another person previously. or or maybe poorly aware about the anatomy. He's not able to differentiate the vagina, urethral orifice, and the umbilicus or anything, right? So though anything is possible. So here the important thing is same thing here. So the dry bite is guys also same. සමහර වෙලාවට නාකි පප්පල වගේ තමයි වයසක වයසක ස්නේක්ස් ලා ආපුවම මොකක්ද වෙන්නේ? ඒගොල්ලෝ නාකි පප්පල වගේ තමයි මොකක්ද වෙන්නේ? venom එක හරියට secrete වෙන්නේ නැති. It can get calcified. These venomous glands can get calcified, so they might not secrete at all. තඩි ලොකුවට අලි ණය. ලොකු පතනයි. ගැහුවා කියලා මුකුත් වෙන්නේ නැහැ. Right? It has been calcified sometimes. මුකුත් මේව නැහැ. ඊට පස්සේ මොකද්ද? Sometimes the thing is the ණය දෂ්ට කරනවා කියන්නේ ණය හපනවා කියන්නේ දෙකක්. කනවා කියන්නේ දෂ්ට කරනවා. So මම අර කිව්වේ ආදරයට හපනවයි තරහට හපනවයි. So the both. So the දෂ්ට කරද්දී තමයි these glands will come up to these teeth and like it will secrete. That ටික ගාවට එන්නේ නැහැ glands මේක. But that is two different stories. And also the thing is prior to that might have bitten some other maybe animal. මීයක් කාලා හරි මොකක් ගෙම්බෙක් කාලා හරි මොකක් කරේ ඉන්න පුළුවන්. ඒක වෙනම් ටික ගිහිල්ලා අරයට හදන්න වෙලාව මදි. Right? So you can apply the same story to here. Right? So right? So anything is possible. So in the Naya sure una, Naya sure. Him una, Naya obvious sure una, Naya kava kila sure. But do you need to know? There is the mark also there, but do you need to give antivenom? No. So here the important thing is, guys, what I have mentioned. So there should be an obvious witness of the snake bite plus non-specific symptoms and signs. So what do you mean by non-specific symptoms? So they might have nausea, they might have vomiting, they might have abdominal pain. So vomiting and abdominal pain is very common, especially following Russell's viper and also following other snakes also. Sometimes they can become drowsy, weakness, and sometimes they can have syncopes as well. So those are non-specific features. But again, if there's an obvious venomous snake bite and if there's an initial non-specific signs, yes, that is an indication, because so 80% of these children who develop these non-specific features will follow these systemic envenoming features in few minutes time. මේක ආවට පස්සේ ටික වෙලාවකින් systemic envenoming features එනවා, complications එනවා, මැරෙනවා. So if you notice this, as soon as you notice initial non-specific signs, and if there's an evidence of obvious snake bite, yes, you need to give. Got it? Hope you had a very clear idea. So next one is, guys, the clinically or laboratory evidence of systemic envenoming. So if there's any clinical or laboratory evidence of systemic envenoming, yes, still you need to give. So what are the systemic envenoming features? So whatever the clinical or investigation wise, if there's a neurological features, if there's any cardiologic features, if there's any features of coagulopathy, if there's any features of hemolysis, and if there's any features of acute renal failure. ඔය මොකක් හරි එකක් තියෙනවා නම් දෙන්න පුළුවන්. Got it? Clear there? So මොනවද neurological? So they can have ptosis, ophthalmoplegia, right? Facial nerve palsy, dysphagia, respiratory muscle, something like that. Yes. The coagulopathy, so they can, if there's any bleeding manifestation, sudden pallor, right? So the hematuria, gum bleeding, melena, hematomesis, yes. Purpura petechiae, yes. The acute renal failure, yes. So anuria, right? So, or even clinically or investigation-wise, if you notice anything suggestive of those things, yes. But here the important thing is, if you haven't seen the snake, so the local reaction per se you don't give. But if you are suspecting a cobra bite, then of course, if there is a significant local reaction, more than half of the limb has involved, still you need to give. But that will not ask in your question. එහෙම දෙයක්ත් තියෙනවා. අපි එච්චර ඇඩ්වාන්ස් දේවල් පේපර් එකේ අහන්නේ නැහැ. ඔයා දැනගන්න ඕනේ මම ඕකේ මෙන්ෂන් කරලා තියෙන 1යි 2යි. So what is the first one? Witness of the obvious venomous snake bite plus initial non-specific symptoms and the clinical or laboratory evidence of systemic envenoming features. Got it? Easy? Easy. So precautions to take. Right now I told you guys, so the practical problem is when you're giving antivenom, they develop a lot of reactions, early reactions, the intermediate and the late reactions. So you need to take maximum precautions to prevent these reactions. So how are you going to prevent these reactions? So today you can do several things during the preparation of antivenom and while you are giving the antivenom, and also when the thing is just before the giving antivenom and while you are giving antivenom. So here the important message is, guys, what when you are preparing this antivenom, so this message is extremely important. So guys, venom api දැකලා තියෙන practical data තමයි. So they will develop more and more reaction if there's more and more bubbling in the solution. පෙන ගොඩක් තිබ්බොත් reactions ඇති. So make sure you minimize this bubbling, right? Or the frothing. පෙන අඩුවෙන් තිබ්බොත් reactions අඩුයි. So here the thing is, guys, when you are dissolving, right? So you need to dissolve very carefully. You take a one vial එකක් ගන්නවා. vial එක අරගෙන මොකද කරන්නේ? හිමීට ඔයා මොකද කරන්නේ? දැන් කුප්පිය ගන්නවා. that is the vial. Right? This is the vial. This will contain a powder. මේක කුඩු එකක් එක්ක තමයි එන්නේ. Right? What you do is you insert the needle with the syringe and you fill with normal saline and you slowly inject 10 ml milliliter the higher milliliter දානවා along the මේක දිගේ ලාවට හිමීට දානවා. ඒතර පිටි දැන් ඔය එකපාර මෙතන forcefully දැම්මොත් මොකද වෙන්නේ? What will happen? So there will be a significant frothing. So you fill it along these wire, right? Along this ball of the wire. So then there will be minimum of frothing. Then make it the mix වෙලා තියෙන කුඩු එකක් එක්ක වතුර. දැන් කොලවන්න ඕන. ඕක අල්ලලා මොකද ගච ගාලා හෙලුවොත් මොකද වෙන්නේ? So then there will be a lot of frothing. So make sure like you do it very smoothly like this, or like rotate you like little bit like this. Try these possible. මෙහෙම rotate කරන්න හරි. එහෙම කරන්න බෑ, but you will never do like this. Got it? Good. Are you clear? So good. So, but like even here, with the minimum frothing, still they can develop reactions. So you need to take precautions, maximum precautions to minimize the you need to minimize these reactions. So you take all the precautions. So just before giving antivenom also, you can take some precautions. So what is that? The most important one is, guys, what you can give subcut adrenaline prior to antivenom treatment. Why? So it will, even if they develop a reaction, you can slow it down. එකපාර ඩුක් ගාලා shock එකට යන්නේ. Right? These reaction will happen gradually. So you will have a bit more time for the anaphylaxis proper anaphylaxis management. Right? So most of these units, they are given hydrocortisone and the chlorpheniramine, but none of these studies have shown like none of these will prevent or reduce the incidence of anaphylaxis. But for the safe side, most of these consultants, they give hydrocortisone and chlorpheniramine. That will not cause no harm, but obviously they haven't shown any benefit as well. So make sure you keep the IM adrenaline ready, and you make sure the ambu bag is ready. Because with these, they can have a lot of reactions. They can have stridor, they can have a significant bronchi and the respiratory failure. And now in addition to that, they can go into anaphylaxis shock. So make sure you are ready with IM adrenaline and the ambu bag. So here, when you are giving also, the thing is, guys, so those days, so you used to give, so the thing is, here you make 10 vials, right? සාමාන්‍ය vial 10ක් හදාගන්නවා මේ වගේ. පළවෙනි එක saline milliliter 10ක් දාලා එකක් ඇතුළට. Then the next one like that. You make 10 vials and you slowly add into the මේක saline එකෙන් අරගෙන slowly inject to the infusion pump. Infusion this is normal saline drip, 200 ml of normal saline drip. So and you attach to an infusion pump and you give. Those days, of course, what we did was like so the initial part or the amount of first vial, we gave it slowly. Vial එකට අදාළ පළවෙනි ටික හිමීට දුන්නේ over 15 minutes. Then of course we gave the rest of the amount over 2 hours. That was the initial management we did. So again, when you are discussing, even if you say this, we will accept completely because that was the practice which we did for so many years. But the very recently, the things have changed. So the people who are sitting for next while, the Raga students who got Raga station, right? So students who got Raga station. So the thing is, even you said the previous one doesn't matter, but because some people are not aware about the recent one, right? Good. So here the important thing is currently, like these recent studies has shown, the reactions does not depend on the rate of the infusion. අපි හිමීට දුන්නත් හයියෙන් දුන්නත් දෙක දෙන්න ගත්තාම ඩිවෙලොප් වෙනවා නම් ඩිවෙලොප් වෙනවාමයි. දැන් අපි වැදගත් දේ මොකද ඉෆෙක්ටිව්නස් එක ටක් ගාලා දුන්නොත් ටක් ගාලා ටොක්සින්ස් ටික නියුට්‍රලයිස් කරනවා ආය කම්ප්ලිකේෂන්ස් එන්නේ නැහැ. ඔයා පැයක් තිස්සේ දෙද්දි පැය ඇතුළතදී වෙන්න තියෙන දේවල් වෙනලා ඉවරයි. So you try to give it early as possible, but make sure you do not overload the fluids, right? So because you are dissolving in 200 ml of normal saline, right? Total of 200 ml. So the thing is, guys, so that's why now we give over half an hour. So you can give everything at a stretch over half an hour. That is the very reason part. But most of the consultants might not be aware also. So even if you say the previous one, doesn't matter. But it will change in next 2 to 3 years. Then ඊළඟ වයිව එක නෙමෙයි ඊට පස්සේ වයිව එකක් නෙමෙයි ඊට පස්සේ වයිව එක all will expect you to tell them, right? Good. So the thing is, guys, the only everything will be same. The management, everything is same to adults and peds. Why? And the reason then I podi lamaya chuttak kanwa kiyala kanne ne. So the toxin effect is same. So the management is same. So but the only difference is, like the adults, you might dissolve in little bit more fluids. So some people they dissolve in 300 to 400 ml, but the pediatrics we dissolve only in 200 ml. Why? Since they are vulnerable to develop fluid overload and heart failure, right? Good. So hope you are very clear. So what are the precautions you take? You try to minimize the frothing. So you normal saline, you add saline along the wall of the glass, and also avoid shaking, and also minimize, like avoid rotate it in a proper way, right? Dissolve in a proper way. You should avoid shaking, right? And also you dissolve 1 vial in a 10 ml of normal saline and make it total of 200 ml. And also you give a subcut adrenaline and make sure the IM adrenaline and the ambu bag is ready. And also you can give fast over half an hour, right? Got it? Good. But at the same time, you need to closely So regarding antivenom, so how are you going to administer? So what is the method? Local site or IM or IV? So the guys, here the important thing is antivenom. You need to give IV. That is the most effective, right? So you need to give IV, but you give it via an infusion, right? Milliliter දෙසිය දාලා infusion pump එක rate එක හදලා පැය භාගයකින් යන්න දාන්න. Got it? So now the thing is, guys, so here the dose is, guys, same as adults. You need to dissolve 10. You need to dissolve 10 vials, right? 10 vials. But the Russell's viper is the only exception. I told you Russell's viper causes the highest mortality, and which contains so many toxins. So for the Russell's viper, you take 20 vials. Vials විස්සක් 10 ml හදලා total එක 200 වෙනකම් හදනවා. තමයි over half an hour. Got it? Good. So the thing is, guys, though, finally, so the management of the reactions. So how are you going to manage the reactions? So this is very important. So this, guys, the thing is, start the management at the earliest sign of reaction. Earliest sign of reaction. So you manage as anaphylaxis. Manage as anaphylaxis as soon as you see the earliest sign of reaction. That is very important. So most of the doctors, they wait till the patient develops shock, blood pressure drop. So by that time the patient will die. Like after that will be too late, and most of the patients will die. That's the one of the reason. Over mismanagement in the patients. So make sure you take your actions as soon as you see the first sign. Right? So if you notice a rash, if you notice a itching, so then of course, guys, what kasana doctor, so you start your management. So what are you going to do? So you suspend the admission or you stop the intravenous antivenom, but you need to stop it temporarily. So you stop it temporarily, right? And you give an IM adrenaline. And you can manage the anaphylaxis part. So what are you going to do? You stop, I told you stop for temporary period. Then once the shock part is settled, you again restart the antivenom. Then what are you going to do? What are you going to do? And double cannula. So you can go for IV adrenaline infusion. And you can titrate. Antivenom, then the blood pressure drop again, and IV adrenaline infusion again. You titrate. And you somehow balance the perfusion. Easy. But you need to give it early also. At the same time, you need to manage these reactions. Right? So if they are not still, if they're drastically, if the blood pressure is drastically dropping, you may need to start the other things also in adjacent. So what can you do? You can give fluid boluses. You can go for IV adrenaline boluses. You can go for glucagon, vasopressin, and other inotroles. Right? So make sure if it is indicated, you give the antivenom right early as possible while controlling the anaphylaxis reaction. Lazy there, right? So you don't stop antivenom permanently. So this is the only place where you don't stop these trigger factors when they develop an anaphylaxis reaction. Right? Got it? Good. Good. So if you know that part, then shalalala. That's all. එච්චරයි ළමයි අපි නිතරම අහන part එක තියෙනවා. So if you know that part, you can get through the part C also very easily, as well as you can answer almost all the questions in your MCQs as well as SPs. So the rest of the things we will not ask very frequently. So just have a rough idea. So even if you don't answer for your part C, we will not reduce your marks significantly, right? So but better to have an idea. So here the thing is, guys, really regarding repeating the antivenom. So most of the time, most of the time, almost always they require only one dose. Doctors but the reality is they require only one dose of antivenom. So the thing is, guys, the usual picture is most of the time the systemic envenoming clinical features will get settled by 1 to 2 hours, right? So the thing is, guys, then the whole blood, the thing is, so usually what we do is whole blood clot time, we repeat it in 6 hours. But the practical issue is most of the time it might be prolonged. And good will take out the prolonged and then. But the reality is, guys, what? So the clotting factors, the half-life is around 24 hours. So to produce new clotting factors, it will take time. So it's not necessary to repeat antivenom after 6 hours. So you can wait about 18 hours. So if after 18 hours also, if it is prolonged or if the patient is clinically deteriorating, then you may need to repeat the antivenom. Now, a patient in clinically better, 18 hours well that past clotting factors may whole blood clotting time prolong. Now you may need to give. So I will ask a small question. Now tell me, guys. Now you gave the antivenom. After two hours time, child had hematemesis and melena and and these urine catheter also it was full of blood stain. Now tell me, Danoshika, what do you think? What are you going to do? What can you do? Any idea? Anyone? Lasita? Come on, guys. If you can answer quickly, I will appreciate it. Yes, Denuani, anyone? Yes, Nadi?
So we first stabilize the patient.
Yes,
Then
very
after
good.
that,
First of all, you stabilize the patient, ABC. Yeah. Then?
and then after that, you can consider giving fresh frozen plasma.
Excellent. So the thing is, as I mentioned, because you can't reverse the damage which has already happened. Clotting factors alter වෙච්ච දේවල් ආය ගන්න බෑනේ. අලුතෙන් හදා ගන්න එපා ඇඟෙන්ම. දැන් toxins ටික තමයි neutralize කරේ. දැන් ඇඟේ තාම නෑ. ඉතින් bleed වෙනවා. So what can you do? You can replace it. No. So you can give fresh frozen plasma and the cryoprecipitate. No. Very good. Excellent, Nadi. Excellent, right? Good. So that you can do, right? Very good. Excellent. So thing is, guys, that is what you need to do. So then finally, supportive care and the management of complications. So how are you going to manage these problems? So one thing is, guys, some children can have significant local effects. So the pain is one of the main problems. So the pain, of course, you can give paracetamol and you can give something like Panadol, but there are practical problems are there when you are using other analgesics. So you can give NSAIDs, but the problem is, guys, so if you are suspecting or if you are not sure about the snake, or just in case if it is Brussels viper, it might worsen the bleeding, right? So that is the dangerous part, whatever the viper bites. So again, the opioids like morphines, again, the problem is following cobra bites and the following these trade bites. So the thing is, it can further worsen the respiratory problems, right? Because it can cause respiratory suppression. So you don't take the risk by giving NSAIDs and opioids. So what can you do is you can give paracetamol and you can give something like Panadol. But if they have severe symptoms, right? So if the pain is so significant, you can call the anesthetic team and you can do a regional nerve block. Easy there? Very lazy there? Practically but right, that is a better option. Okay, good. So the thing is, guys, then some children can go into respiratory failure, so they might just stop breathing. So you may need to start artificial immediately. You need to do ambu ventilation, and you may need to again call the anesthetic team, and maybe if you have confidence, you need to intubate and ventilate, right? So the thing is, guys, sometimes they can have bleeding, significant bleeding. So some may require blood if they are very acutely pale and symptomatic, and if there's an AV, if the PTI-INR and the APTT is very prolonged, and if there's an ongoing bleeding, you may need to add fresh frozen plasma and cryoprecipitate, right? To replace the clotting factors. And also, if there's any clinical evidence or radiological evidence of intracranial hemorrhages, you may need to manage accordingly. That is possible. So again, next, the AKD. AKD කිව්වම සමහර ළමයිගේ මූණ නිකන් hina ගියා. කියලා පපුව අල්ලගත්තා. So පපුව AKD is not, it's not about Andra Kumara Disanayaka ළමයි. It's about acute kidney disease. Okay, right? Right. So here, so the thing is, guys, so if you notice any evidence of acute kidney disease, you need to look for the complications, and they might require dialysis. So the thing is, guys, then some children can develop fluid overload or the pulmonary edema or the heart failure. If you then adult monkey the amount of fluids, right? What is all color? 200 then සමහර medicine 300 400 දෙනවා. Adult medicine පාඩම් කරලා එකපාර 400 ගැහුවොත් මොකද වෙන්නේ? Right? එතකොට ඉතින් fluid overload දෙන්න පුළුවන්. පැය භාගයෙන් 400 ml ගැහුවොත්, right? They can go into pulmonary edema. So the thing is, guys, then of course, just in case if they develop, you may need to give IV furosemide, right? So the thing is, guys, so of course you need to follow up as well, because they can develop long-term complications as well, like chronic ulcers, chronic osteomyelitis, right? And also they can go into chronic kidney disease and also sometimes neurological deficits as well. So got it? Good. So easy? Easy. So the thing is, guys, I want you to again turn your page to the management of snake bite. Management of snake bite. So here the thing is, guys, first of all, what is the most important thing? You manage the airway breathing circulation. So then, of course, you need to do the stabilization, where the thing is, sorry, ABC or the stabilization. The next important thing is you take the first aid measures. So the thing is, there are do's and don'ts, right? කරන්න ඕන දේවල් සහ කරන්න තහනම් දේවල්. So the thing is, guys, calm the child. Make sure like you wash the local bitten area with soap and water, and immobilize the limb and put a splint and keep it below the heart level, and also remove whatever the accessories if they have. And also do not panic, and also do not suck, do not cut, do not keep ice, and do not put any tight tourniquet or band. So thing is, guys, then you need, as soon as you insert a cannula, you need to take blood for the investigation. So the bedside, as a house officer, the whole blood clotting time is the most important one. At the same time, if the facilities are available, send for an urgent PTINR or APTT. And also send for the relevant other investigations, full blood count and blood picture, renal functions, the electrolytes, and also the UFR, VBG, and the blood group in and DT, and also attach to a cardiac monitor and order for an ECG if it is relevant. And if it is, if you're suspecting any respiratory paralysis or arrangements, also you can do spirometry. And also, if you're suspecting intracranial hemorrhages, you can arrange a non-contrast CT brain quickly. And the thing is, guys, so you need to have a very clear idea about how to do the whole blood clotting time. So make a 5 ml of fresh venous sample and keep it in a new plain dry test tube and leave it 20 minutes undisturbed in the room temperature, right? And interpret after 20 minutes. And if you notice any liquid or unclotted area in the tip of the vessel, so that indicates these venom-induced coagulopathy. So the thing is, guys, so then you need to decide, I will take the decision to give antivenom or not. I will consider the risk-benefit balance. You need to tell like that, right, in your Viva. So the thing is, if it is indicated, I will give it early as possible, right? So because it is life-saving and immediately neutralize the effects of the toxins, even though it cannot reverse the effects which has been already happened. So the practical problems are it is very expensive and it can cause so many life-threatening reactions, and 85% of these children patients will develop anaphylaxis. So then snake bite management එකක් Viva එකේ આવත් ඊළඟ question එක මොකක්ද ඉන්නේ? How to manage anaphylaxis. So because 85% of the patients will develop that. Got it? So then you need to have a really clear idea about the indications for the antivenom. So the witness of the obvious venomous snake bite plus initial non-specific systemic envenoming features, symptoms or sign. Why? Because 80% of these patients will follow these systemic envenoming features in few minutes to hours time. So and they will develop complications and they can die. So you can start treatment. And the other indication is any clinical evidence of clinical or laboratory evidence of systemic envenoming. So if they have any neurological features, hemotoxin features, or AKI features, then yes. So the next important thing is you need to know how to prevent, how to take what are the precautions. You need to prevent reactions. So make sure you minimize the frothing, and also you give the subcut adrenaline, and also keep the IM adrenaline and Nambu bags ready. And also nowadays we recommend to give over half an hour. So the thing is, guys, you need to give IV infusion. The thing is, you take 10 vials and dissolve each vial. You will dissolve in 10 ml of normal saline, but for Russell Viper you take 20 vials. And finally you make the solution as 200 ml solution, and you give it over half an hour. So the management of reactions, the most of the important thing is you stabilize the patient, right? You will in elevation, you can give oxygen, and you temporarily suspend this antivenom, and you can give IM adrenaline. And again, you can restart. Again, if they keep on developing, you can start an IV adrenaline infusion, and you can titrate the dose. So the other option, and you have several other options as well. So you hardly need to repeat the antivenom, but if they are clinically deteriorated, or if this whole blood clotting time is prolonged, even after 18 hours, you need to repeat antivenom. So the thing is, guys, the acute stage, you don't give IM tetanus toxoid. Why? මොකද්ද වෙන්නේ? and they are most of these venoms, they are vulnerable to develop these bleeding. So when you give an IM injection, what will happen? They can develop severe hematomas, right? So it's important. So the thing is, guys, you try to manage the, and also if they have completed the immunization, it's not necessary to give IM these tetanus toxins, tetanus vaccine, and also it is not necessary to give in a very acute state. And also the thing is, guys, you need to follow up. You need to manage these complications, the pain, these local reactions, and the respiratory failure, acute renal failure, bleeding, and also the fluid overload. And also you can then, even after discharge, you need to follow up for long-term complications. Good. So thing is, guys, so the prevention of further attacks. So the be vigilant about bites after rains, flooding, and harvest time. Try to wear shoes, boots, and long trousers. Right? And use torch if possible when walking at night. Right? නැත්නම් ඉතින් වෙන වෙන අහිංසක සත්තු මුස්සක හිතා ගන්නවා ගෑවක් ඉස්සර right? අර තියෙන සමහර කූඹියේ. Right? So then try to sleep, right? Try to avoid sleeping on ground. ඔගොල්ලෝ බිම්බුදිය ගන්නවා සමහරු නේද? Right? සැපට නිින්ද සමහරුන් බීම නිදා ගන්නවා. සමහරුන්ට උදේට නැගිටලා පාඩම් කරන්න පුළුවන් බීම නිදා ගන්නවා. සමහරුන්ට හොඳට පාඩම් කරන්න පුළුවන් කලිසම නැතුව පාඩම් කරනවා. එහෙමත් ඉන්නවනේ. ඒ ඔළුවට බ්‍රේන් එකට යනවා වැඩි කියලා සමහරු කියලා තියෙනවා. Right? So there are people are like that. So anyway, so avoid sleep on the ground. So frequently check house gardens for snake, and fishermen should avoid touching sea snakes which has caught in nets. So thing is, guys, so hope you had a very clear idea about snake bites. So we can discuss some few questions, right? So if you can answer these questions, I hope you will be able to answer these questions easily. So then then of course, if you can answer, then done, right? Right. Hope you all can see this slide. So the thing is, guys, so question number 1. Can you all see? I don't know whether you can see. Hope you all have this question paper as well. I sent to your WhatsApp as well as Telegram groups. Right. Can you all see? Now, can you all see? Can you see?
It's shape you can read a bit blur like before, but can manage, I think.
Okay, so you prefer to see my face then. Okay, right. So thing is, right, you have this thing, no? Okay. Now the thing is, here the thing is, guys, now I think someone else can answer. She can answer. So the thing is, a 12-year-old boy with a history of snake bite presented to the hospital with difficulty in breathing. On examination, he appears anxious and he's unable to keep his eyes open. The bite mark is not found. The whole blood clot, 20 minutes whole blood clotting time was normal. What is the most appropriate management? So you all can you send me your answers through the Zoom chat? Very good. Guys, everyone, please send your answers. I really appreciate. So then I know how much do I need to explain. So what is the key point, guys? Whether you are going, so most of the students have sent either B or D, and some have sent A, very few have sent A, and yours. Right, so here, so first one is, guys, so the mail, like, you need to think, right? So what are the answers? Are you giving administer IV hydrocortisone, commence anti-venom treatment, make an attempt to identify the snake, monitor vital parameters and prescribe IV antibiotics. So here the important message is, guys, what? So they have asked most appropriate management. ඔයා දොස්තරන මොකද්ද දොස්තර වශයෙන් කරන මේ ළමයට සුදුසුම දේ. Right? ඔයා තව ටිකක් බලනවාද systemic envenoming features තව එනවාද කියලා බලනවාද නැත්නම් මේ ළමයට indication එකක් තියෙනවද? So what are the indications to give antivenom? So whether if there's an obvious snake bite plus non-specific features. The other one is what? If the child patient develops any clinical or laboratory systemic envenoming features. දැන් මොකද්ද තියෙන්නේ? අවුරුදු 12 ළමයක සර්පෙක් කාලා. Present at the hospital with difficulty in breathing. හුස්ම ගන්න බැලු. Right? On examination, he appears anxious and unable to open his eyes. Bite mark was not found. The 20 minutes whole blood clotting time is normal. Now, Kiara, so can you please unmute? Can you tell what is the answer, and can you explain why you took the answer? It is you can tell anything. It's okay. It's okay. We have a friendly discussion. මම වැරද්දුවත් විතරයි ප්‍රශ්නේ ළමයි. ඒකට වැරද්දුවත් ප්‍රශ්නේ නැහැ.
So the whole blood clotting time is normal. So the antivenom, the second part of the antivenom indication is not possible. Like the indication is not there. And when it comes to then there was a snake bite, but I think that there is no non-specific signs of systemic envenomation because the child can be anxious. Therefore, the child is there's a difficulty in breathing.
Okay. Okay. Right. To Tisura, can you tell? What do you think? Why you took that answer? Tisura Pereira. It's okay.
Hello.
Hello. Yes, Tisura. You
Sir,
can unmute. Can you switch off? Yeah. Yes, Tisura. Good.
It says unable to keep his eyes open.
Mm-hmm.
So I was thinking if it's ptosis.
Yeah.
And then my answer was B, commence antivenom treatment.
Right. So good. So why did I ask these things? Then why I'm asking reasons? The thing is the eye. Abilisco kia camera high කියලා හරියන්නේ නැහනේ. කන එක්කන තමයි රහ වෙන්න ඕනේ. මම හොඳට ඉගෙනුවා හෝ මොනවා හරි වෙන්නත් බෑ. ඕගොල්ලෝ තමයි තේරෙන්න ඕනේ. And I should be able like when I'm delivering a lecture, when I tell facts, so I always feels like everything is so easy. මේ මොනවද කියලා. But the thing is, students might understand in a different way, and I should be well aware, like how they think and everything, right? So then I can explain. So here the important thing, then උත්තර දෙකක් නේ ගොඩක් දෙනෙක් හිටියා. B ගහපුවා ඇතිට D ගහපුවා ඇති. ඔය දෙක තමයි හිටියේ. So හැබැයි එක උත්තරයකට විතර හරි ලකුණ එන්නේ. So here the important message is, guys, what? So you don't need to have all their features, indications. So if you have the obvious witness of snake bite with an systemic envenoming feature, obvious snake bite with a non-specific features, then you can give it. Now, පොළඟ කෑවා, බඩේ අමාරුවක් හරි වමනේ ගියා. You can give. මුකුත්ම නැහැ, හොයාගන්න බෑ. නිකන් එනවා මොනවා හරි systemic envenoming features clinically or laboratory wise තිබ්බොත් yes. The whole blood clotting time is ගොඩක් වෙලේ prolonged. This was an exam question, huh? Whole blood clotting time එක prolonged ERP question, right? Whole blood clotting time එක prolonged වෙන්නේ කොයි එකද? Commonly following Russell's, but it can occur following other snake bites also. But one of the important thing is, guys, what do you think, Tisura? What is the likely snake which has been ළමයා කාලා තියෙන මොකක්ද?
Common grade.
Yeah, the grade. මගමාරුවා සද්ද නැතුව කාලා. So there was no even bite mark. Whole blood clotting time was also no. That's why I told that example. This only come with these ptosis, and this child, unfortunately, even the respiration also has been involved. So the thing is, guys, so of course, so if in the absence of those systemic envenoming features, you could have monitor for some time. But for this child, you can't wait. You need to start the antivenom early as possible. So the IV comments on IV antivenom is the the best answer. Right? Most appropriate management is that. Got it? Yes. Good. So we'll move to the next one. Good. So 8-year-old boy presented to the emergency unit with a history of snake bite 1 hour ago. They have not seen the snake. Right? එකට ඇවිල්ලා පැයක් සර්පෙක් කාලා පැයක් විතර දැන් සර්පයා හරියට දැකලා සර්පයා මොකಾದ කියලා හරියට දැකලා නැහැ. On examination, his left ankle is swollen and there's a flank mark was there. The blood pressure was 100/65 and the pulse rate was 100 and the respiratory rate was 24. No signs of systemic envenomation. What is the next most important management option? So intramuscular tetanus toxoid administration, and next most important management option. Intramuscular tetanus toxoid administration, clean with normal saline and wrap the swollen limb. Observe for systemic envenomation for next 24 to 48 hours. Give oral flucloxacillin, intravenous antivenom as low infusion. So send me answers. Send me answers. Others, everyone. Come on, guys. Everyone. This will improve your thinking capacity. Also, you can make any mistakes. Quickly. ළමයි තාම 6 දෙනා ඉවලා තියෙන ඉක්මනට එවන්න. ටක් ගාලා. Everyone. Come on, quickly. So Tavishi saying, Chamatnanya kar saying, Shanil, Fernando. This is Zoom chat. Hope you all aware, right? Press that. Good. Again, like the answers are fluctuating between two stems. Most of the students have marked either C or E, right? So again, it's very tricky and dangerous. It's not so easy, right? So here the thing is, guys, 8-year-old boy presented to the emergency unit with a history of snake bite 1 hour ago. Sarpe khala. So some students actually they are unable to take the information very straight away. So then at least try to convert it into Sinhala and somehow make sure you can understand the question, right? So I know those are some practical issues for some students, right? So, but make sure you can understand this question very clearly, right? 8-year-old boy presented to the emergency unit with a history of snake bite 1 hour ago. This sarpe kala. They have not seen the snake. Sarpe kala have been naya mukada kila hariyata dakala naha. On examination, his left ankle is swollen and has a fang mark. Kagu mark ekut තියෙනවා කකුලත් ලොකුලා. ඒ කියන්නේ සර්පෙක් දැන් දත් පාරකුත් තියෙනවා. ලොකුත් මේ කකුලත් ඉදිමිලා තියෙනවා. නායක වගේ එකෙක්ව දැකලා තියෙනවා. Blood pressure is normal, pulse pressure is normal, and the respiratory rate normal. So hemodynamic is stable, and no systemic envenoming features. So what is the most appropriate next step, most important management option? Now, dear Shini, Nadira. So I will ask you questions. Now tell me. So now only 1 hour has gone, right? But there is a local swelling is there, right? So left ankle has been swollen. So still it can be anything. It can be anything. But what are the more likely possible snakes?
Harmless vipers.
One thing is harmless viper. Very good. Then
Possibly cobra, but by this time there should be neuro.
yeah. But sometimes it might present a little bit late. So
Okay.
ID is possible. No,
Yeah.
ID is possible. So why this child hasn't developed any systemic envenoming features still? So there are again two possibilities are there. One thing is the snake may be non-venomous
Non-venomous.
snake. What is the other possibility?
Venom wasn't secreted.
Yeah, the other
Just the
possibilities, yeah. One is non-venomous and the other one is like dry bite. The other thing is not still so it have like still 1 hour,
Oh, yeah.
1 hour is gone. So like too early to develop these symptoms. So it is possible. So at the moment, is there any indication to give IV and antivenom or not to this child?
So there is no systemic features
No systemic
and no
yes.
confirmed snake bite.
No confirmed snake
So
bite.
then it's not an
So just
indication.
the mild local
Yeah.
reaction.
We
So
just observe,
yeah.
closely monitor the child.
Yeah. So the intramuscular tetanus, you don't give it in acute state, and the normal saline, and you don't wrap the swollen lymph. Right? You clean with normal saline, it's okay, but you don't wrap it. So do observe for systemic, give oral flucloxamine. So if there is any secondary evidence of secondary infections, yes, you give. Otherwise, not. And also, there is no indication to give intravenous antivenom, right? So that's why I ask you all to highlight that. Okay, indications to give antivenom, right? So they will keep on asking about that. That's the criteria, right? So here the best option is, guys, what? Observe for systemic envenomation within next 24 to 48 hours. Got it? Then problem how much marks will carry for SBS? One SBA will carry 5 marks. Right? But over exam SBS may වුණත් මොකද වෙන්නේ? ලකුණු අඩු වෙලා එක්කෙනෙක් කාර්ගල top rank එකක් අනිත් එක්කෙනා හොඳටම අඩු. Right? I think, guys, this is the practically what we see in your. So this is only one topic. So it's not easy to like do it in a proper way if you don't get the proper guidance, right? In the the questions related to the entire syllabus, right? So here the important message is, guys. So that's right. So you can make mistakes, and some students might get like upset, but don't worry. Most of you all, like, of course, you all will have time. And one of the important thing is that's why I do a separate course called SBHX program to make sure none of my students get failed in the exam. So you will get a very perfect clear idea, and you will get 200% perfect, where I'm discussing more than 300 questions, past paper questions, where the questions of more than 20 papers, but that is not the important thing. That the important message is, guys, what? Here, the thing is, I'm discussing each and every, like, the key important features which we expect from you all, and how the new questions deviate and like that. So you will be able to answer whatever the new questions, right? So I have made everything easy. So the thing is, once you follow that, so you will be able to definitely get through the exams, and that's one of the main reasons none of my students get failed in the exams. So you don't need to worry. You have time. Don't get upset or depressed after, like you might not still, like, you don't have much experience. So the thing is, you might make mistakes, but you will be able to improve very soon, right? Good. Right. So the thing is, guys, so question number 3. So here the important one is, guys, what? So question number 3, 6-year-old boy slept at 9 p.m. They sleep on the floor in a hut. Again, a past with question, right? At 3 a.m. in morning, he develops an abdominal pain. Then he was brought to the hospital. After admission, he developed ptosis, and he's not dehydrated, but has abnormal breathing pattern. What is the most likely diagnosis? Cobra, crate, scorpion bite, DKA, acute pancreatitis. Yes. Send me answers. Anything okay? Come on, guys, send me answers. Very good, Tiara, very good, Lasita, very good, Chamat, very good, Senuri, very good, Muhammad, Dilshan. Excellent, right? So here, what is it? Same story, right? So Magamarua, Budiankitia, Kava, Gahua, and Badek Market Naginam in hospital, Tamaru. So classical, these neurological manifestation, and also they were non-specific symptoms also previously. So the answer is trade bite, or answer is B. Right? Good. Excellent. So the question number 4. A 4-year-old child who had an unknown bite while playing. Child drew the bitten animal on a paper which was likely a snake. දැන් කොල්ලට හරියට කියන්න තේරෙන්නේ නැහැ. දැන් චිත්‍රයක් අඳින්න ගිහම ඔන්න නායක කැඳලා. කුඹියෙක් නෙමෙයි නායක සර්පෙක් පැන්දලා. After admission, child was investigated and observed for 24 hours for developing any clinical signs. There were no abnormality except bitten mark and mild localized swelling over the right toe. What is the most appropriate management for this child? So give antivenom immediately, give IV cefotaxime, reassure and follow up, IM tetanus toxoid. Repeat whole blood clotting time and observe the child for another 48 hours. So it is a bit difficult. It is not a past paper question, but it is difficult. It's very tricky, guys. So it's again, even if you have make any mistakes, it's not a past paper. It's a bit advanced question, but again, it doesn't matter. So here the problem is, guys. So there's an unknown snake bite while playing. After admission, child was investigated and observed for 24 hours. So they have sent all the investigations. By 24 hours, definitely they have should receive they have done the several times whole blood clotting time, as well as they have received these TTINR and the APTT report, right? So everything was normal. So the thing is, no clinical evidence or laboratory evidence of systemic envenoming. So there has been bitten mark and mild localized reaction over the right side of the toe, and the most appropriate management. So here the thing is, guys, so that you don't give antivenom immediately, and there's no indication to give. So this is most likely these hump nose viper bite. කකුල විතර චුට්ටක් මේ වෙලා තියෙනවා. හැබැයි වෙන මොකෙක් හරි සතෙක් වෙන්න සමහර වෙලාවට පුළුවන්, right? It is possible. පොඩි swelling එකක් නේ තිබිලා තියෙන්නේ. So no, it stays out. We also out. You don't need to give antibiotics for just for the mild swelling. And the thing is, guys, the IM tetanus toxoid is the child has received this immunization also previously and not required during the acute state. So you can repeat the whole blood clotting time and so the thing is, guys, so here the thing is, they have already done several times the Pavisia, and by that time they have received the most is accurate report, which is the TTINR APTT report. But it's normal. And it features 24 hours. It's unlikely to be a venomous snake. So here the most appropriate management would be you can reissue and you can follow up in the ward or the clinic. Discharge. Then you can decide on rest of the necessary further management. So then, guys, 5-year-old child was brought to the hospital following a snake bite. Villagers have brought the snakes with the child to the hospital, and it was confirmed as a Russell's viper. Right, before this, I want to tell you something. The hospital it will help in management, but the practical problem is, guys, sarpaya gain කොහොමද? පණ පිටින් ගේන්නේ. එහෙමනම් පණ පිටින් බෝතලයක දැම්මොත් ඕකේ. පණ පිටින් ගෝණියක දාලා ගේන්නේ. ගෝණියක දාලා කවුද ගෝණිය ඇරලා පැන්නොත්? That is a practical issue. So when I was at Ragama, now currently I'm at Ashwelaris, when I was at Ragama, so there was a snake bite, and the villagers have brought. Then හොයාගෙන ණයව උස්සගෙන ඇවිල්ලා. ණයව වාහනේ දාලා ඩිකියේ ගෝණියක දාලා ගෙනල්ලා. ඊට පස්සේ ගෝණිය ගිහිලා security එකපාර ඇතුළට ගෙනියලා ගෝණිය තියලා තියෙනවා security මේක ගාව ටිකක් තියලා. ඊට පස්සේ වාට්ටුවේ ටිකක් දැන් ડોක්ටර් emergency එක manage කරනකම් වාට්ටුවේ තියලා. ඊට පස්සේ ડોක්ටර් ABC සැපිලා හරි ડોක්ටර් දැන් ණයව ගෙනාවා කියලා අපේ. right අපි මම රාගම් proc unit ඒතෝ රෑ 7ට විතර ඇති proc unit එකේ මේකේ මොනවද කාර් පාක් එක එතනමයි තින්නේ ඒ හරිය එතන තමයි පාක් කරලා ඊට පස්සේ වෝඩ් එකට ඇවිල්ලා මම දැන් ණයව මරලාද ගෙනාවේ නැහැ පන පිටින් ගෙනල්ලා තියෙනවා අමාරුවෙන් දැන් ගෝණිය ලොකුයි මීට දැන් කවුරුත් අරිනවට කැමතිත් නැහැ හරි එහෙනම් ඕක ගෙනාපු අයටම ඉමීට අරින්න කියලා මේ ඉමීට අරලා බලන්නේ මොකද ණය නැහැ ණය මිසින් දැන් මොකද ප්‍රොබ්ලම් එක what is the wrong දැන් ණය කොහෙටද ගියේ ණය කාර් එක ඇතුලේ අස්සක රිංගලාද කාර් එකේ වෙන්න පුළුවන් ණය කාර් පාක් එකේ පල්හා එළියේද security ගාවද වෝඩ් එක ඇතුලේද දැන් මුළු ඉස්පිරිතාලෙම නටනවා right then that happens so අන්තිමට මේ patient කාර් එක තියලා තිබ්බ දවස් 5ක් තියලා තිබ්බා ගෙනියන්නේ නැතුව මේ ලෙඩා හොඳ කරලා ගැව්වා මොකද තිබ්බෙත් නැහැ ලෙඩා no systemic envenoming features we just monitored and ABC බල්ලා monitor කරලා we send the child but the car was there for 5 days right those are some practical issues so the thing is but I know there are like beliefs and everything among y'all but the thing is make sure like you bring it in a proper way right okay so here the 5-year-old child was brought to the hospital following a snake bite villagers have brought the snake with the child to the hospital and it was confirmed as a Russell's viper on admission child was complaining about abdominal pain and which was vomited 2 times prior to admission which has vomited the child has vomited 2 times prior to admission. The child was hemodynamically stable and there is no positive systemic envenoming features on admission. What is the most appropriate immediate next step in the management? ඕකේ ළමයි මෙතන පොඩි මේකක් තියෙනවා ඔකේ හදා ගන්න ඕනේ arrange කියන වචනය කපන්න 20 minutes whole blood clotting time that's all erase the arrange term now send me answers right, good. Guys, so I think most of students have sent the A or C. So here the thing is, guys, there's an obvious Russell's white bite was there. And the thing is, guys, and also child had abdominal pain and vomiting, which are non-specific symptoms. So does this child require antivenom? Yes, exactly. So if it is arranged 20 minutes whole blood clotting time, so you can start, like you can take the blood for 20 minutes whole blood clotting time. But the thing is, you don't need to wait till the result. You don't need to wait 20 minutes. Why? Since the child there's an obvious venomous snake bite and there's a non-specific symptoms are there. So you can straight away start anti-venom treatment. So after taking the blood for the sample, whole blood, right? You take the blood, keep it, and you can start the treatment. So the whole blood clotting time, just whole blood clotting time means what? So you need to take the blood and you need to wait till the result. Right? Result again, so the best answer is what? The C. Right? Easy? Good. So, sorry, yes, IV can insert an IV cannula and give antivenom. So here they have given, mentioned IV antivenom, no. IM antivenom, no. And observe for 24 hours systemic envenom, no. Insert and catheter and you want the urine output, you need to make sure that you can save the child. So these questions, MCQs are very easy, quickly. So which of the following snake bites with systemic envenoming features required antivenom? So cobra, obviously yes. Saw scale viper, obviously yes. The Indian crate, obviously yes. So send me the answers for D and E. Very good, Anjana. Very good, Lasita. Very good, Tiara. Very good, Senri. Yes. So very good, guys. So see, හිටියොත් ඔයගලන්ට ආන්සර් කරන්න පුළුවන්. දැන් බලන්න මේ ලෙක්චර් එක ඔයගලන්ට පාඩම් කරන්න ඕනේ වුණාද? ඉවර වෙලා මේ වෙලේම ඔළුවට දාගත්තද? ආයෙ අමතක වෙනවද? So that's why you need to learn everything in a rational way. Then you will not forget and you will be able to easily recall. Right? That's right. Right? So that is very important. Make sure you understand then and then you can do whatever the question after that. Right? Good. So here the thing is then. So the green pit pipe and snake, sea snakes, false. You can't give the available anti-venom. It's not indicated. Right? Good. Even those are venomous snakes. Which of the appropriate first aid measures following a snake bite? So reassure and calm the patient. Yeah, you need to calm the patient, right? Apply ice. Ice can ඔගොල්ලෝ මේ දවස්වල කතා කරන්නේ නෙමෙයි ice cat ගැන කියන්නේ, right? එතකොට අරකට contraindicated මේකත් contraindicated, right? Medicine වල නම් ඔය සමහර වෙලාවට දීලා එනවා. ඕක කැක්කම අඩු කරගන්න, right? That's සමහර වෙලාවට ආයුර්වේද කට්ටිය කොලත් එවන්නේ. We have seen. Right, right? All right. So, right, so you don't apply ice. Paracetamol to relieve pain. Yes, you can give paracetamol. Yes. So use a conventional tight band, tight tourniquet. Then get the ready cap. Kumina pandol peti dekak ba gilawat ප්‍රශ්න නැහැ. Aspirin බොන්න පුළුවන්ද? Sensate, right? Non-steroidal anti-inflammatory drugs. Okay. So use a conventional tight tourniquet or constrictive band about the bitten side. No. Massage the bitten local side. Massage right? Okay, good. So the thing is, guys, true or false regarding antivenom? So indicated for all the venomous snakes. No. So you give it only for cobras, kraits, and the sawscale and the Russell's viper, right? You don't give it for sea snakes and these green pit vipers. Good. Commence anti-venom serum soon as systemic envenoming features has been detected. Yes. That asuru sani denna one, right? So you need to give it early as possible, so to neutralize the toxins. Good. So because the damage, the damages will be irreversible, so you right, so give it early as possible. So localized administration of antivenom at site of the bite is recommended before developing systemic envenoming features. Right? Okay, so you don't give it. That's a two different. So the rabies, of course, we are giving around the local side because it's penetrates the terminal nerve ends, right? So then of course then it will it can go so to avoid that only like you give that, but here there is no indication as such. So the cobra bites usually requires only one dose of antivenom serum. What do you think? What do you think, guys? Yeah, exactly. Good. So the thing is, guys, because almost always they require only one dose. Rarely sometimes for the muscle swiper they may require two doses, right? But the cobra and traits almost always require one dose of anti-venom serum, right? Good. So same amount of anti-venom is given to both children and adults. Yes, exactly, right? So so they both require the same amount of anti-venom. So the answers are, hope you all are very clear. So the A is indicated for all, false. Come in soon as possible, true. Local site administration, false. And cobra bites required only one dose of antivenom, yes, true. And the same amount of antivenom is given to both children and adults, again, yes, true.
Excuse me, sir.
Yes.
So for all snakes, is one antivenom available at hospital?
So there is non-specific. The polyvalent antivenom is there. That is the common antivenom, that is the antivenom which is there in almost all the hospitals. So you give that. So in Sri Lanka we have only two. That is the polyvalent antivenom. So that will work only for the snakes which I have mentioned, the cobra, crates, and the Russells and the saw scale viper. For the others, it will not work. It will not be effective. And also there is something called monospecific antivenom in Sri Lanka, but we don't practice that much. That is called the polanga tag, right? ඒක පොළඟට විතරයි හරියන්නේ. right? අනිත් අයට ඒක හරියන්නේත් නැහැ. ඒ හින්දා තමයි අර කට්ටි 5 දිනාටම හරියන එක පොලිවේලන්ට් එක අපි දෙන්නේ. Right? That is the reason. Okay?
Thank you.
Good. So, any other questions? That's good.
Sir,
yes.
So can you,
of course, I can hear you.
When are we giving tetanus toxide?
Yes. So the thing is, if they have completed the pediatrics and the adult medicine, it's a bit different. But if they have completed the immunization, you don't need to give it at all. And that immunity will be there for 10 years, right? So you don't need to give. And the thing is, and you will never give in the acute state. So the thing is, because since they are vulnerable to develop hematomas, right?
Yes.
Guys, ask. Any other questions?
Sir, can you hear me?
Yeah, Levantine, yes, of course.
Sir, how to relate the dose to the number of vials, sir? Like,
no, first of all, you take 10 vials, then you take 10 ml into a syringe and you dissolve that particular vial. So that vial will contain 10 ml of normal saline with the antivenom. Then like that, you will prepare 10 vials, right? Then now altogether you have 100 ml, no? Right? So then you take 100 ml of normal saline, and from the each vial you take it into a syringe and you inject to this normal saline bottle, which contain 100 ml. So altogether now you have 200 ml, right? So then you attach to an infusion pump and you give it over half an hour. So previously we gave the amount 10 ml, or that is the first dose, the amount of first vial, 10 ml or 15 minutes, and then the rest of the things. But nowadays you can straight away give over half an hour. Rest of the things we previously gave over 1 hour, right? ඉස්සර හිමීට දුන්නේ බයෙන් බයෙන්. දැන් එහෙම එකක් කියන්නේ you can do it fast over half an hour. You are only scared about fluid overload. That's why rather than giving them rapid bolus, you are giving over half an hour.
Sir, excuse me. If you
Yes,
don't
sir.
mind, just a clarification. So
Yes,
if we are taking 10 vials, and we are take one vial mixing with, is it 10 milliliter saline or what? Why didn't get that?
Sorry, yeah, you are dissolving in a normal 10 ml of normal saline.
So then all 10 vials are doing like that. Then what's the rest? Could you please explain it a bit?
So you prepare 10 vials now. So the one vial contains 10 ml. So the 10 vials means you have 100 ml. So you need to prepare the complete solution as 200 ml. So you take 100 ml of normal saline and you inject the each and everything into that without these fucking, right? Taking all the precautions. So then altogether now you have 200 ml. And you attach to an infusion pump and you give it over half an hour.
Okay, so thank you.
But when it comes to a Russell's viper, you take 20 vials. So anyway, you have prepared 200 ml. So you can straight away put together and you can do it. But adults, of course, some consultants, they dissolve in a 300 or they prepare the entire solution as 300 ml or 400 ml. So Anjana, that is 5. So don't we give as a total of 500 normal saline? Yeah, adult patients and the very obese and very big children, you can give. But as I mentioned in pediatrics, we are very cautious about fluid overload as well. Nowadays, we are planning to give we are giving very rapidly, no? So the risk of overload also high, but again, it's not necessary to dissolve in that much of normal saline. Any other questions? Good. Then you must have learned these dissolving things in various ways in various lecturers or from books. So the thing is, there is no like hard and fast rule thing. They make sure like learn the concept. So the thing is, one important thing is you need nowadays we like as I mentioned the reactions like developing reactions are not related to the rate of the infusion. Whether you give it rapidly or slowly, anyway they will develop the reaction. So you can give it rapidly. That is the first one. And you need to give it early as possible. But at the same time, make sure you will not overload the fluids. ඔය ෆැක්ට්ස් තුන තමයි ඔළුවේ තියෙන්නේ. මේ කවුරු හරි එක්කනේ 200ක දිය කරත් 300ක දිය කරත් 400ක දිය කරත් ප්‍රශ්නයක් නැහැ. පැය කාලෙකින් දීලා දුන්නත් එකයි පැයකින් දුන්නත් එකයි මේ. But the thing is, if you can give it quickly and if you have dissolved in a little bit less amount, then you can give it more rapidly, without minimum complications, and you can neutralize these toxins very soon. That is the whole concept, right? Got it? හරිද? දැන් ළමයි ඕගොල්ලන්ගේ ප්‍රශ්නේ මොකක්ද ළමයි? Now the thing is when in your medicine දැන් ඔය science කියන දේ ඕගොල්ලෝ සමහර දේවල් අර මෙහෙමනේ තියන් ඉන්නේ. The science, then the guidelines. Guidelines are always a guide. It's always like you know, like ඒ කියන්නේ ඔයා වැඩ දන්නේ නැත්නම් තමයි guideline එකට stuck වෙන්නේ. Guideline is important. But the thing is, one, if you are very smart, if you have mastered, and if you have very clear idea, and if you know the pathophysiology and everything, so you go to the base, learn what it happened, how it happens, the pathophysiology, and then you will be able to work out, and you will know what is the best. And always the patient management is tailor-made. ඒ ලෙඩාට ඒක ගැලපෙන්න, මේ ලෙඩාට මේක ගැලපෙන්න, right? So the guidelines will help you. But always know the pathophysiology and what is best for the patients. So when you get a real patient, always think like infant කෙනෙක් නම්, for example, small infant කෙනෙක් මාස 5යි. Then you don't give it to a half an hour. You try give it a little bit slowly. එයාට overload දෙන්න risk එක වැඩි නෑ. පොතේ තියෙන පැය භාගය මම පැය භාගයෙන් ගන්නවා. There is nothing like that. Right? So use your common sense. That's why ඒකනේ දොස්තරලා මේ bright අය දොස්තරලා කරන්න try කරන්නේ. සහ අපි ඕගොල්ලන්ව bright කරවන්න හදන්නේ. Right? උට ලේ පාවිච්චි කරලා වැඩ කරන්න ඉස්පිරිතාලේ. ඒකනේ බලාපොරොත්තු වෙන්නේ. Right? එහෙනම් like be more practical. Guideline or science කියන්නේ මේ එහෙම නෙමෙයි. Right? Use some common sense, right? And things will get changed with time. Right? Right? Okay. So good. So any other questions? Great. Okay. So if there's any question, right? Hope you learned a lot, guys. So then, so I hope you learned a lot, and you will learn more and more important things in following weeks. And so some students so some students actually for the theory students, actually I want to tell some students actually already have joined these theory classes, and these have covered so many topics. So it's everything is there in the platform, and also it's 24/7 available, and you can cover the things early very quickly, and you can get smart. And the students who are very they are in the fourth year final year, then the thing is, again, for them also, they can cover the things early and they can get perfect and smart right before their ERPM. So then everything would be easy. So here the thing is, then after once you graduated, you can cover these MCQ based topic wise revision and SBH program, and you can get 200% perfect, and you will be you will have no doubts. You will be mastered in pediatrics, right? So you will be smarter than even a consultant, right? That related to the common topics, common diseases, right? They will be well aware about these rare ones, but you can be smart, become smarter than even consultants, right? Related to common topics. So learn things in a very proper way. But they are not studying no. ඒගොල්ලෝ පාඩම් කර කර ඉන්නේ නැහැ නේ වයිව් එකට එද්දි. ඒගොල්ලෝ වයිව් එකට එන්නේ පාඩම් කරලා ඒගොල්ලෝ පාඩම් කරලා එන්නේ නැහැ. Right? But ඕගොල්ලෝ smart වෙන්න ඕනේ ඒගොල්ලන්ට වැඩි, and most of my students are like that now. Right? So here the thing is they learn the things in a very correct and cover the things early as possible. Right, and soon I will be doing more and more updated important lectures, and also doing a lot of papers, starting papers also, questions and papers also in near future. And you can always contact me. Hope you all are there in one of my WhatsApp or Telegram groups. I will update you all. So if there's anything, always feel free to contact me. So then, see you guys.
Excuse me, sir.
Yes.
One small request, sir.
Yeah.
If you don't mind, this session was really worth. I really, not only me, I think everyone would like to rewatch it. And if you don't mind, could you please upload this session to the study reserve? Is it possible?
Yeah. Okay. Right. Either study reserve or the YouTube. I will do that for since you requested.
Thank you so much, sir.
Okay. Great. So then, guys. Right. Okay. Right. Then, guys, have a nice day. So then I will see you. Then see you guys. Bye.
Thank you, sir.
Thank you, sir.